Trevor Brown from First Baptist Church. Dr. Brown?
You bet. Let me lead us in prayer as we begin. God, we are most of all grateful for who you are and for what you provide for us, God, for opportunities like this to work together, to serve one another. And we give you thanks for all that you give us. We give you thanks for these leaders, for the many who would be a part of this meeting and others that work so diligently to meet the needs of our city and to serve our citizens. So, God, we pray your hand of blessing on this meeting, on their time together. We pray that you would protect us and continue to lead our efforts to protect one another with our COVID virus response. God, we give you thanks for the ways that vaccines and progress and so many good things are already underway and doing such good things in our community. God, we pray that you would give wisdom and clarity for all the decisions being made and for those that will be made today. God, we pray most of all that you would help us to know you more and more, that we might know your will more fully, that we might carry it out on this earth. God, we pray your blessing over this meeting and pray all these things in Jesus' name. Amen.
Amen. Thank you, Dr. Brown.
You're welcome.
Next, we have a proclamation regarding Dr. Martin Luther King Jr. Day, which is coming up on Monday. So I've asked Councilwoman Frida Powell to read that proclamation for us today and introduce our guests. Councilwoman Powell?
Yes, thank you, Mayor. Good afternoon to everyone and Happy New Year to you, Mayor, as well as my fellow council members. It is an honor and a privilege to be able to present the proclamation for Martin Luther King Jr. Day. Whereas, as a husband, father, and pastor, Dr. Martin Luther King Jr. is one of the most distinguished civil human rights leaders in history and dedicated his life to preaching peace and understanding. And whereas, in a time of division and strife, Dr. King sought unity in the face of discrimination. He fought for universal respect, and whereas we have made tremendous strides in the more than 50 years since Dr. King's movement, and we hope our nation continues to embrace unity in the next 50 years. Now, therefore, we, Mayor and City Council members of the City of Amarillo, Texas, do hereby proclaim Monday, January 18th, 2021, as Dr. Martin Luther King Jr. Day in Amarillo, and encourage all citizens to make it a day on and not a day off, and celebrate Dr. King's legacy by volunteering to improve our community. Given under our hands and seal of office this 12th day of January 2021, the Honorable Mayor Ginger Nelson, Council members Elaine Hayes, Frida Powell, Dr. Eddie Sauer, and Howard Smith. And then I'd like to just say, as we celebrate the life and achievements of Dr. Martin Luther King Jr., it is a day for all of us to remember that whatever differences we may have in terms of ethnicity or culture, we can overcome them for the benefit of our city and for society. With the 2021 new year just beginning, this is a great opportune time for us as parents to help our children set a respectful and kind tone for each other and for the year and throughout their lives. So with that, I would like to present to you all R.J. Solijaks. He is the principal at Bivens Elementary School here in Amarillo, and he's going to accept the proclamation and also make a few comments. So I'd like to welcome you on behalf of Mayor Ginger Nelson and our council.
All right, thank you guys. I am excited to be here and just honored to accept the proclamation today for the city for MLK Jr. Day. Sorry, school's still going on. And I'm just excited to do that and just continue to talk about his legacy in a way where today we are still seeing many of those same issues in society and challenging our community to be the change. That is our motto for the Dr. Martin Luther King Jr. March that will be held on Monday. And we are challenging our community to be part of that change. We see the motions and the pieces in place. I'm in the position I am in because AISD has decided as well to be part of that change. and lead in types of conversations that we're having in the school district, such as unconscious bias, and working to find equity in all of our decisions. So again, thank you. And I just wanted to share just some details about the day. We will have that march on Monday. It will be, we'll begin lining up about 10 o'clock outside of New Hope Baptist Church. That's off of 900 North Hayden's. And then we will be traveling towards Bones Hooks Park alongside of the AISD marching band, which is an exciting moment because our march has never had a marching band going along with it. So that will be new, and it will be just a great event for the day. We'll begin the walk at 11. When we get to the park, there'll be a few short speeches and we'll disperse afterwards. I just want to tell the community, please be a part of this day because, again, we are challenging you to be the change. It is city permitted and COVID-19 safe, so please make sure you bring your mask, walking shoes, a positive mindset, and be, just ready to be a part of the great things we have going on. And I'd like to just end with some thanks to you guys for, stepping forward as a city council and knowing that each year this is an important event for our community and walking beside us. AISD, of course, I'd like to thank XL Energy, United Supermarkets, Trinity Fellowship, News Channel 7, and Happy State Bank for also just helping sponsor the event. And then also a special thanks to all of our law enforcement and Chief Bergenfield, because without them, the safety of our citizens and the safety of this event isn't looked at the same. So I just want to thank you guys for your time and your effort in that.
Well, Mr. Solijax, we agree with all of that. And I would say we're in the presence of greatness in having you join us at our meeting today as an Amarilloan on the move, named by the newspaper for the new year. It makes me very proud of the work that you're doing at the school district, your work that you're doing on this project with MLK, and we're really honored to have you here as a guest at our meeting today.
Thank you very much. It's been an interesting year, so to say the least, but I've always said that our biggest challenges will also reap our biggest rewards, and they're coming out, and again, big things are happening, and I'm just glad to be a part of it.
Yeah, that's wonderful. We can all get behind that for sure. And I would just echo, I have visited with the organizers. I had a good conversation with Keith Graves this week about keeping it COVID safe to do this event. It is outdoors. They will be encouraging folks to socially distance, which there'll be plenty of room for you and your family to be there, spaced out from everyone else, and asking you to wear masks because we want to be able to gather, but we need to do it in a way that respects our hospitals and our medical workers. So I really appreciate the efforts you guys are making in putting this event together to keep it COVID safe. Thanks.
Yes, ma'am. Thank you.
Thank you, RJ.
Could we just repeat the details again on the time that it starts and the location just one more time for people who were possibly not paying attention to some of the details at the very beginning?
Yes, ma'am. Yes, we will begin lining up for the march at 10 o'clock at New Hope Baptist Church, which is located at 900 North Hayden. Then we will proceed to the march will begin at 11. We will march to Bones Hooks Park. That's why I said bring your walking shoes. It's a little over a mile, 1.1 miles, between that location and Bones Hooks Park. And then it will be, when we get there, there'll be a few short speeches, and then again, we'll disperse quickly afterwards.
Thank you, sir. I appreciate giving me time to grab my pen and go back and write all that down.
Yes,
Thank you so much. And it was a pleasure having you with us today. Look forward to next Monday.
I appreciate it, and I hope to see all y'all there.
Thanks, Mr. Solijax. Thanks, Councilwoman Powell, for doing that proclamation for us. And I will turn it over now to Stephanie Coggins, our call moderator, to open up public address.
Thank you, Mayor. We have one individual signed up for public address today. So before I turn it over to that individual, I want to remind you, you'll have 3 minutes to give your comments to council. No disparaging comments. Keep it to the items on the agenda, please. Council, for your feedback. Just keep it to the items on the agenda. So Miss Jolie Santiago is with us. And Miss Santiago, you should be able to talk now. You may need to press *6 on your telephone to unmute yourself.
Good afternoon. Can you hear me?
Yes, ma'am, we can. Please start whenever you're ready.
Okay. So I just wanted to say that I really appreciate you guys' leadership and in everything that you guys been doing. Of course, we're not going to have always agree on things, but one of the things that I wanted to comment on is, let's see, at first I thought it was possible business dumping in Amarillo with the Amazon, the tax abatement, but then I did my research and I found out that it was like something that the one of Kevin's projects that I guess he was working on, pretty excited about. And so I support any kind of business that is coming in, but I just beg of you not to allow any foreign people to take our jobs, because it's our prayer that we've been praying for generations and generations that our children grow up to be leaders and not followers. As you may know, I grew up on the north side of Amarillo, and we could really use a lot of leaders and stuff on that side and that precinct or whatever. But with the ordinance that you guys are probably going to discuss on bringing outside entities or foreign entities, that's really something that I'm concerned about, is because if you really, really believe in Amarillo and the children in the schools and what you're doing for it, you would not bring outside people in to take our jobs. And so that's my comment.
Thank you for being with us today. Stephanie, do we
You're
have
welcome.
other people for public address?
We conclude public address at this time.
Okay, thank you then.
Mayor,
We'll
I
move on.
think we had at least one other person submit comment that, but they did not want to speak, and we forwarded those to council.
Okay, thank you, Jared. Appreciate that. Moving on to item 1A on the agenda. Item 1A is reviewing the agenda items for the regular meeting and attachments. Any questions up front, council, about the packet you received? Okay, hearing nothing, then let's move on to item 1B, the coronavirus update. Mr. City Manager.
All right, Mayor, we've things have been moving fast over the last handful of weeks. We've got Casey Stoughton here to bring you up to speed with where we're at right now. And then we've got a number of people on the presentation to be able to answer any questions council has. Casey?
Thank you. I do have a little bit of information to share, and then I have some pictures. I think pictures sometimes are worth 1,000 words, so we'll kick things off this morning with the data. So as of today, there are a total of 30,713 cases of COVID-19 in Potter and Randall counties. 15,778 cases in Potter County and 14,935 cases in Randall County. We have a total of 27,030 recoveries, and that is excellent news. We, however, are up to 538 deaths here in our community, and that is we're very sad about each and every death. That is a stark number. That leaves us with 3,145 active cases. Each of the cases, again, do represent a unique individual. The total rolling 7-day positivity average for Potter and Randall counties is at 13%. The positivity rate at the drive-through testing site is at 29%, and the 5-day new positive case average is at 219 new cases per day. The public health drive-through testing site does remain operational, and individuals can call 378-6300 to be screened and directed to the test site. GA32's hospitalization rate for the 25 county Panhandle RAC region has been over 15% for the last couple of months. Yesterday, the RAC's Panhandle hospitalization percentage was at 21.4%, meaning that just over 21% of all hospitalized patients have COVID. Our community does remain at status level red. Conditions remain consistent with indicators being over that threshold for status level red. Local hospitalization rate is at 6.5%. That means that 6.5% of all of the people who have active COVID-19 are requiring hospitalization. We have a total of 197 patients currently hospitalized with COVID-19. Adult bed utilization is at 88.5%. ICU utilization is at 83%. And ventilator use is down to 47%. The outpatient bamlanivimab infusion center is currently open, and we're serving patients. We've seen a total of 65 patients through the city's bamlanivimab infusion center, and only one patient has required hospitalization. So that center has certainly been a success. A quick update on that BAM center. We had been operating out of a tent that was supported by the RAC on BSA property. We appreciate the support of the RAC and DSHS for that operation. Monday, however, we moved from the tent to a more permanent location across the street from City Hall. The building at 509 South Johnson is a perfect place for our infusion center. The proximity to the Civic Center was ideal for staffing and has some amenities that are helpful to patients. And so we have had a seamless transition there to that new location and are still serving patients. In fact, we made that move Saturday afternoon, Sunday, and were able to serve patients Monday morning. And I have pictures of both the tent and the center at 509 South Johnson. So I'll show you those in just a minute. On the vaccine front, that's another huge success that we have. As of today, the public health department and our team at the Civic Center Clinic has given almost all of the vaccines supplied by the state. It is a huge success. We're currently open and giving vaccine. The lines are fairly short today, so if you haven't had a chance to get vaccine, or if you know somebody who hasn't, please send someone that you know. We've received a total of 18,000 doses of vaccine. And so far, since this morning, we've given, as of this morning, and when we started clinic, December 28th, we've given 15,700 doses. So you can see our team is really running through doses very quickly. Our highest throughput day was over 2,800 patients in one day. And each day we improved the wait time dramatically. Social distancing has been observed to keep patients safe. And I've got pictures of that operation as well. Our communications team has worked very hard to promote the vaccine clinic in a variety of ways. Each day we send a press release or press notice about the vaccination clinic availability and hours. We have posts daily on social media, again, about those hours and availability of vaccine. We run multilingual electronic billboards announcing clinic times. AmarilloAlerts.com has truly been a one-stop shop for this COVID vaccine or this COVID response. And we've got a special place on AmarilloAlerts.com dedicated to vaccine. And we've had over 10,000 visits in the last 24 hours. So people truly are accessing that website. On the website, you can see we have a available or unavailable marker to denote if we have vaccine or not. That doesn't necessarily mean the clinic is open or closed. It just means if we have vaccine available. So you've got to look down right below that to see what the clinic hours are. Our staff do eventually have to go home. It's a requirement that we let them go home every now and then. We have special press releases and social media alerts throughout the day as needed. If the line gets short, we want people to know that so they can come down and be vaccinated. We've got some things coming up, some planned events. We're sending out multilingual postcards to everyone in our utility billing database. And so everyone should be getting a postcard here pretty quick to let them know even more information about the clinic and to direct them to AmarilloAlerts.com. We're going to be pushing out a poll to measure our dissemination process and to gather feedback on the clinic, and then working with community leaders so that they can get the word out to those people in their circles. And so I could not say thank you more to first of all, our community. They have shown up to be vaccinated in ways that are just big. I couldn't say thank you more to our team. We have a truly outstanding city team, from transit to public health, communications, fire, police, the library staff. I know I'm going to forget somebody, but wow, we have an amazing team. And our civic center staff, wow, talk about flexible. They have made it work. I think they may have gotten their training from Disney World because they know how to move people through a line. And so I just couldn't appreciate our city staff more. We've worked with the RAC. We have 25 nurses that have come in from the RAC, and that has really sped up our process even more. So we're able to see about 500 people an hour if we have kind of pressure all day long. So while we've seen 2,800 patients is our highest number, I think we can see more if we maintained pressure all day. We've worked with BritCare to bring in more wheelchairs and oxygen. We needed to switch out some oxygen containers early on. And so we have just, your public health department is truly amazing. I do have some pictures, so if you'll bear with me while I share my screen. And so this is a picture of our operations center where we do contact investigation there at the Civic Center. And so you can see our team working. It's also cold. And so we have people are kind of bundled up, you can see, but they're working really hard to do the data entry and the contact investigations. This is a schema of the layout there of the Civic Center. So people come in through door 3. If the lines are short, we're able to cut this path down pretty quickly, and they just move into the South Exhibit Hall. If not, and the lines are very long, we want to make sure that people can stay inside as long as possible. So we have 7.5 football fields worth of line. And so they come in first, go into the Heritage Room, and then down the hall, wrap around the Coliseum, and then back into the South Exhibit Hall, where we have 288 chairs to welcome them for a rest until they move into the North Exhibit Hall, where we provide their vaccine with 30 vaccine booths and vaccination providers, and then the post-vaccine monitoring area where they wait 15 minutes. So again, not like Disney World, but kind of like Disney World, where you get to stand in line and then get your vaccine there at the end. This is a picture. It's nice to kind of see what that schema looks like. Our staff are there to welcome them. We do encourage social distancing. You can see there the Heritage Room. If we do have to open that space up, then they can wait there in the Heritage Room.
Casey, can we pause right there? I would anticipate other council members too. I'm hearing people say, that's great about the clinic. I'm not going to the clinic because I can't wait in a long line. And so we see a picture of this gentleman in a wheelchair. And I'm saying to citizens, as they're greeted at the door, they can ask for a wheelchair or just say, I know I can't stand for long periods of time. Talk us through how the staff is handling that.
Absolutely. So we have a number of wheelchairs at the front door and are ready to serve patients who may have mobility challenges or have another need for that. We also have a fast track area, and so if someone just can't stand in that line, then we're ready to serve them in that fast track area. And our staff, our fire department, our team are looking for people who need that service and are also able to serve people who ask for that service. And so we want to make this as easy as possible. When we move into the South Exhibit Hall, we've got 288 chairs here, and we are able to move through this room very quickly. Carol, this is a picture of our screening team. They do just an outstanding job. I put a picture of the microphone in here just to remind me. Carol and Marcus are kind of manning this team. Carol is our assistant director, and they do a really amazing stand-up routine while they're giving information, but it's also very similar to like a Southwest Airlines when you go on your boarding and they're telling you all about the oxygen and everything. So Carol and Marcus have worked up a routine where they're talking about the clinic in kind of a Southwest Airlines motif. So it's really fun. This is a picture of the room where you actually get vaccine. And so you can see our nurses and the patients there. We have 30 booths where our nurses give vaccine. And so again, that process runs very, very quickly. And then into patient monitoring for 15 minutes. These are just a picture of the wheelchairs. Again, we appreciate Brick Care for, we called them in a hurry and they brought those wheelchairs down very quickly. We had 6 to start the clinic, and they brought wheelchairs very quickly for us. This is a picture of the tents where we were serving patients with that bamlanivimab infusion. We did have 2 tents, and this is a picture of the inside of the tent. And so our patients were being served here. We did move on Monday to 509 South Johnson. And here's a picture of what the inside of that space looks like. So just a more permanent structure.
Council, do you have questions for Casey?
I do. I sure do. I want to make a couple of comments first. A couple of the comments are, I think that Casey deserves a standing ovation for the work that she's done. It's outstanding. People all over the state know who she is. I'm grateful for her forward thinking. And part of it's actually a little bit personal. And I found out about it through the Panhandle District Dental Society. She contacted the Panhandle District Dental Society and said, you guys are outpatient clinics. You qualify to be 1A. And let me tell you something. The second you did that, Casey, the TDA knows who you are, because they've been begging for that designation. And it's coming from people like you that are public health directors locally, recognizing the fact that we do see patients less than 6 inches constantly. And and I appreciate that ability. I was there Monday at noon whenever you opened it up to get my vaccination. And I want to tell you thank you. The other ones that I want to say a debt of gratitude to is also City Manager Jared Miller and our Mayor, Ginger Nelson. Ginger, I appreciate the fact that you have made it a constant effort to stay in touch with the governor's office. Because if it wasn't for you staying in touch with the governor's office, I don't believe we'd have the 25 RAC nurses that are helping us get through this. So I appreciate your advocacy for us with the governor. I appreciate that you've developed a rapport with his office and they take your calls. Jared, I am grateful for the way that you have marshaled all of this and made for sure that it came to pass and came to fruition. It starts at the head. It doesn't start somewhere down the road. And so I appreciate all that you've actually done. I've got a couple of comments that I want to make about the numbers, Casey. I think the numbers are, I know we've got a long ways to go, but they're outstanding. I know the difficult day that we had Monday before Thanksgiving, and I know what our rates were at that point in time. We were averaging over 500 cases a day. Our hospitalization rate that day was 40%. I know we've got a long ways to go, but at over 500 patients a day, and now then our 7-day rolling average is 219 a day, that says something for what has occurred, the way that the citizens in the city have picked up the fact that we have got to do better and we got to do more. And I'm grateful for the way everybody stepped up. Everybody's been afraid of what's going to happen after Thanksgiving, after Christmas, after New Year's, and we are far enough past the New Year's that we would start to be seeing numbers really going up, and they haven't started doing that yet. So I'm very grateful. I think all of these changes and how we got serious about things, coinciding with the release of the vaccine and getting patients vaccinated, give us a leg up because we are completely different than the rest of the United States right now. Everybody's trending up. They're in the worst positions that they've ever been, and we're at about 50% of the worst position that we were at. And so I'm just really making these observations, and it's a debt of gratitude and a prayer of thanks for the way that things have actually gone for our community, and just continue to ask our community to continue to stay the course just a little bit longer, and we can make this work really well. I want to ask a little bit about the BAM clinic, the Regional Infusion Center. So you've only given 65, you only had 65 infusions so far. So this is the one thing that I want to ask about is, how does a person who is positive with COVID that's starting to show symptoms, how do they have to go through their doctor? Can they call the public health department? Number one, how do they get that infusion?
So they have to have a referral. We have to have a referral from a physician. And
Okay.
so, and that can be any physician or a nurse practitioner, a provider. It could be a PA, a nurse practitioner, a physician, but we do have to have a referral. They have to meet the EUA criteria set in place by the FDA for that medication. And so we have a couple of times sent health advisories to our everyone that we have contact information for, including the Potter Randall Medical Society, so that our medical community has access to that information. We will send information again, however we can make contact with anybody, but they do have to have a referral.
Okay, so another thing I wanted to ask is, so my mom came down with COVID right after Thanksgiving, and she started having a cough, and definitely has comorbidities, including her age. And so she ended up at Northwest Texas Emergency Room at Soncy and Hillside, because that's where she went to get her PCR test so she could go see my dad in a memory care facility. And so she ended up going there. So whenever they administer BAM there, that's not part of what this allowance is at all, is it?
No, so we're fortunate that we do have multiple sites that are able to administer BAM. So the hospitals are able to do that through the emergency departments. I think that they may be able to do some through urgent cares, and then we have a separate location now here at 509 South Johnson.
Okay, so and the thing about that was Mom went there, and they were her referring physician, and they did it there. And it was, I believe my mom had started to develop a cough, and she wouldn't have been able to make it through the week, or the weekend would not have been a good situation for her. And so, and then I had another friend who got a hold of me wanting to know about some of these things. And I hope I don't overrun the Northwest Texas Emergency Center out there at Soncy and Hillside, but they do a great job. It's a shout out to them. They're taking care of patients. You come in, you qualify with the comorbidities. They've got physicians on staff. They're making sure and I believe it's a life-saving opportunity. I wish more people were taking advantage of it, and I will shout out the fact that this monoclonal antibody treatment is very, very effective. And to say the least, there's been 65 infusions done, which I think are way too few. And out of that, only one person has ended up in the hospital. Says something stellar for what's going on. And I just applaud you guys. 15,700 vaccines have been given so far, and you guys have done a great job. I'll give you a standing ovation.
Thank you very much, sir. I appreciate that.
Hey,
and I'll pass
Eddie,
that on to our team.
on that note, I really do want to give Casey a standing O. I think the council should all literally, I want to see it on behalf of citizens. Hold it. I'm asking Stephanie to take a picture for us.
She's a rock star.
Steph, did you get the
thank
picture?
The picture is taken.
Okay, thank you, because it's worthy of that, Casey and Jared, both of you, in all the different departments. I won't repeat all of that. It's been an overwhelming response. And Casey, I want you to tell, you've had even sweet citizens safely delivering things to the clinic, but tell the story about, there was a lady that brought donuts, but tell the story about the lady that brought the signs.
Yes, so Saturday we had a clinic, and a sweet, sweet lady named Pat brought us donuts. And so thank you, Pat, if you're watching. And then another lady, so I love how invested Amarillo is. Like, we are all in.
Yes.
And so another lady, when in that room, in the South Exhibit Hall, with 288 chairs, if you're in the back of the room, it can be a little hard to see. And so our screeners will put their hand in the air, and one of our staff members will direct you to the screener that you're going to go to. And this sweet lady came back to the clinic, and she said, she said it was kind of hard to see the screener from the back of the room. She said, so I just went home and made these signs that you could hold up so that we could see you from the back of the room. She said, I didn't want to say anything because I thought the clinic was perfect, but I just thought that this might make it a little easier. So she went home and made some signs that we could hold up, and we are using them. So I know they're in there right now using those signs. So thank you to the sweet lady who made the signs. We're using your signs. In fact, we added numbers to them. She made them out of green kind of craft foam. And so we added numbers. So now we can say in the very back of the room, go to screener number 14. And so Amarillo is truly invested in the success of this clinic. And I could not appreciate our community more.
Yeah. Council, other questions for Casey? Thank you, Casey, for telling that story. Councilmember Hayes?
And Casey, I also want to just pass along. I've had several citizens just call or text and compliment just the logistics, the system. It's been very efficient. People really appreciate the privacy, how you've set up just the privacy during the actual vaccinations. And so just well done. And the community is very appreciative, and we are hearing from them. I want to be sure that it gets passed along to you. If you would, again, just address right now who qualifies. Dr. Sauer talked about 1A, 1B, and just so people know right now who qualifies to come to the Civic Center and get the vaccinations.
That's a great question. So right now we're in phase 1A and 1B. And so 1A are those frontline healthcare workers, and 1B is anybody 65 and older, and anybody under 65 to the clinic at the Civic Center would be 18 and older, and with a chronic healthcare condition, and that chronic healthcare condition that would put them at risk for a complication if they got COVID. So some of those might be heart disease, or diabetes, or COPD, immunosuppression. So any kind of a chronic health condition that would put them at risk for a complication of COVID. And so that's the categories of people. It's also important to remember that if you have had a monoclonal antibody, like the bamlanivimab, then you, or Regeneron or remdesivir, then you need to wait 90 days to get the vaccine. If you've had another vaccine like your flu shot or your shingles vaccine, then you need to wait 14 days to get your COVID vaccine. You also need to wait 14 days from your COVID vaccine to get another vaccine. So timing is important there. And then if you're allergic to any of the components of the vaccine, and we give the Moderna vaccine at the Civic Center, that's what's been shipped to us right now. If you're allergic to any of those components, then you should not get the vaccine. And we have fact sheets, and in those fact sheets, it has a list of all of the components, so we can get that information to anybody really quickly.
And currently, hasn't the Moderna vaccine had fewer complications, side effect complications, than the Pfizer up to this point?
I would have to look. I'm sure you're right. I know out of 15,000 people, we've had one person, and it was a fairly minor reaction.
Yeah, and I think everything that I've been reading, all the documentation has been really concerning the Pfizer vaccine.
So Casey, can you kind of talk us through a little bit on who administers to our at-risk populations in nursing homes, assisted living facilities, just, the private deliverance of vaccinations versus city outreach?
Absolutely. So our nursing homes and those long-term care facilities have had an opportunity to sign up with the federal program and a state program. And so this pharmacies like CVS and Walgreens are partnering with those nursing homes and long-term care facilities, and will be making appointments if they haven't already to go on site to vaccinate them. We're working with the state health department to make sure that that's being done here locally, because we want to make sure that people are being taken care of.
And can you talk to us about then like the second round of vaccinations? How is that managed, kind of the time frame, when you begin giving notices, things like that? I know there has all those timelines you were just talking about. You get too soon, you have issues. You wait too long, you have issues. So can you speak to that?
Absolutely. So there with the Moderna vaccine that we're giving, you need to wait at least 28 days before you get your second dose. Anytime after 28 days is okay to get that second dose. So you can wait anytime after 28 days, and you don't have to start your series over. You just get the second dose, but not sooner than 28 days. With the Pfizer vaccine, that's 21 days. And so bring your card back when you come back to the Civic Center, and that's kind of your fast pass through the clinic. We are making plans to kind of streamline that, but we will have clinic, and so we're developing an FAQ that we'll have on the AmarilloAlerts.com, and we'll have yet another sign. So we'll have like phase 1A available, phase 2 available, and second doses. So we'll have another indicator there on AmarilloAlerts.com when those second doses are available.
You can't go get your second dose at 28 days with the Moderna, and you end up not being able to get there until 2 or 3 months later. You haven't compromised the effectiveness of the vaccine. You just have waited. Okay.
Right. Yeah.
There's not a time limit, though.
There's not a maximum time. There's only a minimum time.
Okay.
Yep.
Other questions?
I had one more. I wanted to give other council member a chance to jump in there. I wanted to follow up on one of the points that Dr. Sauer made, and it's on the BAM infusion. And I echo his same position that I wish we were seeing more. I think it is an underused resource, and to have, again, wanting to focus on early intervention and things that especially for our more at-risk population. And so I just want to be encouraging our citizens that if you fall in those categories, and Casey, you may want to just re-emphasize those again. I've heard a few different conversations, but it sounds like we're pretty flexible in opening, and we have availability to do treatments for more individuals. And so I just would encourage people, don't wait. If you fall in these categories that Casey's fixing to address, don't wait until you're showing a lot of symptoms. Don't wait until your health begins to decline. It's proactive. It's getting ahead of it, and as Dr. Sauer pointed out, it's being very effective. And so, if you can just speak to that and just encouraging people that would fall in those categories that would qualify for this treatment, and trying to head it off before we see people at the ER and having to be hospitalized.
Yes, so that's a great question. So the BAM, and I don't have all of the criteria right in front of me, so I'll speak kind of in general terms, but anyone 65 and older would qualify. 55 and older, there's a set of like healthcare conditions, and I believe those are more like respiratory and heart related. And then anyone 18 and older, and those would be, again, those respiratory, heart, and then some more immunocompromising, like diabetes and different things. And so there's, so again, it's kind of similar to that phase 1B. But I can send that to the council, those criteria specifically, but it's, so 55 and older, kind of COPD, respiratory, heart disease, and then as we move younger, the criteria would be more in like an immunosuppression, anybody with diabetes, those kinds of conditions.
Yeah, so I would again say to our community, assume that you can qualify, follow it up, and find out that you don't, as opposed to assuming the other direction. Try and take advantage of this, and especially with us moving into that permanent facility, this is something that it's a great opportunity. You have facilitated a great location. Reminding our community, take advantage of it. Call, be sure, find out if you can qualify for it.
Absolutely, thank you, ma'am.
Other questions?
Can you explain, we got 200,000 people in Amarillo. How many of them are over 65? And I know it's voluntary to get a shot, but I think it's fantastic that we vaccinated 15,700. So how many more do we have to go, assuming 95% of them get a vaccine that are eligible?
You know, I think that's a great question too. I think somewhere probably between 40 and 50% of our community would probably qualify. The criteria for phase 1B is, it's anybody who has a chronic healthcare condition. It even lists pregnancy as a chronic healthcare condition, although we know that chronic healthcare condition does end at some point. And then it includes obesity or someone with a BMI of over 30. And so I think that we have, do have a good number of people here in our community that qualify. And so again, just like Ms. Hayes said, if you think you qualify, let's see, it's better to seek it out and find that you don't qualify than it is to assume that you don't. I think that was a very wise thing to say.
It's kind of like what I told my mom. She didn't want to go because she didn't know if she qualified. And I said, what's your worst case scenario, Mom? They're going to send you home, right? What's your best case scenario? They're going to give you the infusion. And that's so true.
Howard, on the DSHS website, they have some demographic data for our health district. So if you'll grab a pen, I'll tell you what came off of that website.
Really?
Okay. As far as people who are above age 65 or older, in Randall County, that's 21,784. In Potter County, that's 16,187. So that's about 37,000 people who fit that age criteria. Then our category 1A workers, so our healthcare workers, we have I could give you those exact numbers again. It's 4,683 for Randall County, 12,650 for Potter County. So about 17,000 healthcare workers. And then it also includes nursing home residents. So in Randall County, there's 869 nursing home residents. In Potter County, there's 1,877. So if you just round all those numbers, the total for all of those people we just touched is almost 57,000 people. They don't have any demographic information for people who are age 18 to 64 but have an underlying health condition. So we know the baseline number population-wise is basically 57,000. And then your guess at how many people would fit into that underlying medical condition, you would add on top of that. And that's the number of people currently in Potter and Randall counties who are eligible to receive the vaccine. It's a big number. It's a lot of people. It's a very good question, by the way.
Do we expect that we'll get vaccines to keep doing it like we're doing it 5 days a week?
I do anticipate another shipment next week. I don't know exactly how many doses that will be. Somebody else may know, but this has certainly been an amazing team effort. So we put our heads together and.
So Casey, one more question about the vaccination thing. I know that we are a huge regional hub. So if someone is coming in from Oklahoma Panhandle, coming from Western Oklahoma, coming from Eastern New Mexico, are you guys turning them away?
No, sir.
I didn't think, and I think that's the correct answer. Thank you. That's kind of another about who we are.
We know that this is where people receive health care and shopping, and so it's.
One more thing I'd like to say. When you first started, the lines were very long. It was very cold, and a lot of lines were outside. But I like it that you basically moved it mostly inside. So I have had nothing but compliments about the procedure. I have a son lives in Waco, another son lives in Plano. We're way ahead of them in a procedure of doing this. So I compliment you, Casey, and the others that put all this plan together. Just keep it up. Thank you.
Thank you, sir. Thank you very much, sir.
A citizen question, if we planned on trying to set up any kind of a drive-through vaccination area. And, for me personally, hearing you describe the fact that people who maybe cannot stand physically in a line that would be facilitated, help through a drive-through vaccination location, the way you have it set up right now, it sounds like really you're already addressing those individuals that might need that type of service.
Absolutely. So we want to pull them through our fast track area and make sure that we're serving them very quickly. I think, our team talked for a long time about the different approaches and different ways we could do it in a drive-through. We have to monitor people for 15 minutes. And so if we had all of these people who were coming through our clinic in cars and we had to park them, if somebody did have a problem, they would have to honk or flash their lights or something. And that would, that just might make it a little harder to respond if somebody were having a problem. And so we just want to make sure that we're moving people through the line very quickly, but also doing it in a very safe way. So we're not opposed to it, but flexibility has been the name of the game here. And I think that you're certainly seeing the adaptability and the flexibility of all of the teams involved.
Other questions for Casey? Okay. Casey, we appreciate you. Thanks for the report.
Thank you all. I appreciate you all. Thank you very much.
Jared, anything else on coronavirus?
I want to say one small thing. I do appreciate the kind words from Dr. Sauer and from others, but it is very appropriate, and it is usually almost always appropriate to shift praise to the people that are actually doing the hard work. And in this case, it's very appropriate to recognize, Casey she's not just a local, expert. The governor knows her name, and she's just doing such a great job, not only locally, but also statewide, because this is the model. What we're doing here is the model for what they're trying to implement at other mass infusion sites or vaccination sites. So that's a big deal, but there's so many others. Kevin Starbuck, Deputy City Manager, doing a lot to help coordinate this effort and lead it. Casey Sherman, Civic Center, Marita with Transit, Amanda with the library, Michael Kashuba over at Parks, Jordan with communications, Andrew with planning, City Manager's office efforts, from a variety of different people, Chief Mays, Chief Birkenfeld with the police and fire departments. There's people I'm leaving off, but it's these people each leading small parts in their teams, bringing value add with their creative ideas, with their customer service ideas. I can't go deep enough into the organization. I mean, I have to because of time, but I can't go deep enough into the organization and run out of people who are coming up with great ideas to make this thing work better. So I really do want to make sure that we recognize the ones that are really doing the good, hard work day in and day out, on their feet all day long, moving the line, making sure people have water, making sure they know where to go, where the restroom is, all the little things that make this thing successful. It's been a huge home run. So thank you to everyone I mentioned and everyone I forgot.
Good. Thank you, Jared. Let's move on to agenda item 1C, which is an update on animal management and welfare.
Right. We've got our interim director of animal management and welfare, Rob Sherwin, here to give us an update on what's going on. He's also got some team there with him that can help answer any questions that council has. Rob, take it away.
All right. Mayor and council, it's good to finally see everybody. For those of you who haven't met me, been here since the end of October, and happy to say that animal management welfare is running pretty well. Always having issues, but everything else does. Wanted to share a PowerPoint that we've prepared for you guys, and after we're done, please ask any questions you have. And if you see something in the middle of the PowerPoint, just please let me know. All right. Can everybody see that?
Nope, not yet.
All right. I think I said. Hold on. We see it now.
Yes, we do.
All right. Always technical. Okay. One of the first things I kind of wanted to give you is the philosophy that I think kind of needs to guide the decisions here at Animal Management and Welfare. Number one, I think a serious thing that we need to talk about is we need to protect our people from dangerous animals. And we are doing that, and we're going to get into the presentation a little more about our animal management officers, our field division, the folks that go out to the calls of dangerous dogs, stray dogs, animal welfare calls, and that's kind of one of our guiding principles. The second part is to provide a healthy shelter for all those animals we bring in, all those strays that we get from the field. And the third part is we want to increase positive outcomes from our shelter because when you're bringing animals in, you need to get animals out in a positive way. In doing that, we have increased animal management officers to answer calls for service. We hired 4 new trainees just this week. They're currently undergoing 6 weeks of training, which is the first time that's been done, my understanding. It's a much more formal process, so we hope that our retention is quite longer than it has been. In this training, they're receiving help from Amarillo PD for crime scene and report writing. The AECC teaches CAD and dispatch best practices, and also the officers get to go down there and see how this all works together. A state mandated class for animal control officers is mandated, and we'll have that. I think the lady who did the last one will be back here in March. And just to give you guys some good news, we had 5 animal management officers complete training. These people were hired in August, and they received their badges on the 5th. And they're in the field currently taking calls from our citizens and doing a great job. So our badge ceremony with masks and great. So they're excited, they're motivated, and they're doing a great job. I wanted to also bring up, we've had a lot of help from a lot of folks, but one of the things I think the real success story is improving our public access via online reporting. We put some processes in our web so citizens can now just electronically file barking complaints, animal reports, lost and found, bite investigations. A lot of what we're getting is, can I adopt this animal? And I'm sure you guys heard complaints about not being able to get a hold of somebody down at Animal Management. Well, obviously this provides a record, and it notifies everybody in the management group, and we simply assign it to each group that needs to work it. If it's a field problem, we send it to the field people. And if it's adoption, we have the adoption folks contact them. And it has really, really reduced those calls to the dispatch center. And I think that citizens are much more satisfied with that service. We should have done it a long time ago, but it's working well. We'll look for more ways to improve it as we go on.
Rob, can I interrupt you for a second? Can you give us the URL of that website to do that online reporting and requesting?
It is on the Amarillo Animal Management Welfare on the city's website. And if you go onto that website, you will have general reporting. It also, we're going to talk about the daily report card that we produced, and it has a ton of information on its top scroll. And I would like to come down, and you can go down and make a request of us, and it's just got to fill in the blank. And you found a stray animal, you found all this stuff. We get that information, and we just simply assign it to somebody.
So you start with amarillo.gov, and then you're going to Animal Management.
Yep. And at the top of the page, you'll see everything up there that you can get a hold of.
Okay. So just wanting people to be able to walk us through of where you start, and then you start vetting after there.
Correct. And it doesn't have to be totally correct. We'll work our way through the problems because we have some drop downs, and sometimes it doesn't really apply to those. We're answering every one of those we can. So if they leave a phone number or contact, we get a hold of them. All right.
Thank you.
One of the things we've been working on is increasing our staffing. The staffing here got pretty low, but we're at 74% of our budgeted positions are now filled, and we continue to work on our vacancies. One of our success stories in the last few weeks has been we've finally hired a part-time vet that's working out tremendously. We have our 3 vet tech positions who support that vet and handles the medical calls in the shelter. So previously what we were doing was having to pack our animals up that were sick, take them to a local vet. And I want to thank every one of the vets in this community that has helped us out. But we waited in line, we had to work with the public, and it was very difficult. Our new vet handles all these chronic illnesses that keeps our shelter animals healthy. The plan is to get this new observation building online and our equipment in here so that we can do our own in-house spay and neuter surgeries. And so that we can get these animals from the time they come in until they leave, they'll be spayed and neutered, fully vaccinated, everything's working, and will be much more streamlined once we get that up. We are currently interviewing for animal care workers, which is a constant need. Those are our folks that clean our kennels every day, 7 days a week. And it's critical that these kennels are clean so we can keep diseases down and our animals healthy. I kind of wanted to show you guys, if you haven't seen it yet, also council members, it's been online for some time. This is a daily report card, and it is just simply a piece of information that I think the citizens would love to see. Note that if you look on the left in intakes, this was a daily count. Now the intake and outcomes, that comes from the previous day. The kennel percent full and capacity are right then at the morning. So that is an immediate snapshot of what's going on in the kennels. And what you want to look at is the field, which is those new animal control officers out there in the field. They picked up 9 dogs the day before. And the shelter brought in 6 more animals from a variety of owner surrenders or people just bringing in stray animals. And then if you look down at outcomes, you have 3 adoptions, but the big success right now is working with our advocacy groups who took out 13 animals and transferred them to rescue groups, or we were able to relocate them back with their owners. So that's a significant part. And what it does is, this is kind of a constant issue with shelters. If you look at our capacity for dogs, we have 142 kennels. We're 14%. And the other day before that, we were at 171 dogs. Cats do a little bit better, but we had a hoarding case just this last week and we went over capacity, but we were able to work with our partners and get some of those cats out. The thing that I think that a lot of people want to know about and the issue about the shelter is euthanasia. And so we're transparent. We get that number out there, and if we have to do euthanasias for either owner requested or the animal's injured, we're going to put that information out there for you guys to look at. And we welcome questions from the public as why we do it, but we're an open admission shelter, and we're going to need to do that for animals that are they're not adoptable. The new observation building is, I'm sitting here right now. We're in the middle of a remodel on the old building. This building was funded by Prop 2. It contains the field services officer, so it's actually got a workspace for our field officers and a place for them to do their reports, a training room, which we're using right now for those new animal management officers who are getting trained, locker rooms, which they haven't had. And then on the other side of the building, we have a brand new vet medical area, which I'm looking forward to showing you guys when it's equipped. We have a bunch of surgical equipment and I thank all the people in the city that worked with me in getting the same equipment that Texas Tech's vet school has. So when we have 4th-year vet students come over, they'll be working on the same exact equipment that Texas Tech did, and we were able to purchase it at Texas Tech's contract rate. So it was a very good deal, and I think it's going to work really, really well for our partnership with Texas Tech. We also have quarantine kennels over here for our animals that are in bite quarantine under rabies investigation, and that will keep them out of the public area in a much more secure facility over here. Our public access area, where it's been, if you guys don't know about this, shelter was built in 1974, is being remodeled with more of an open concept so that we can have a better flow for adoptions. And then our owner surrender side hopefully will be done, and we can have kind of a separation of those two transactions. Adoptions are generally considered a happy thing. Owner surrenders are not so happy. Therefore, you try to keep those separate. Right now, we're having to do those together. The director and assistant director selection continues to move forward. We had 11 applicants for the director, and it looks like we have 2 remaining for final interview, and we anticipate getting this position filled before the end of January. The assistant director, the reviews continue to go forward, and we anticipate filling that position before mid-February. And I'll take some questions.
So, Rob, I just kind of wanted to say thank you for coming in and bringing some order and some developing a foundation that has been much needed here for animal management and welfare. Very grateful for what you're getting started and off the ground. And from the things that I'm hearing and the things that I'm seeing and the people that I'm talking to, that they're saying it just is really changing the whole atmosphere. You're developing a different culture out there that, and I'm just looking forward to the way that you are setting up and reestablishing the relationships with the animal advocacy groups going forward. I just feel like that you're setting something in place that will be foundational for decades to come. And just really appreciate your expertise and how you're helping us move this forward.
Any other questions for Rob, Council? Rob, it was a good report and a lot of good work, and things are trending in a much better direction. So we really do appreciate all the effort that you're making for us.
Thank you.
Jared, do you have anything to add to that as far as that report?
Just excited about all the good things. Really pleased. Same.
Okay. Then we'll move on to agenda item 1D, which is a presentation and report on the Amarillo Community Investment Program. Mr.
We've got Kyle Schneiderjohn is going to be making that presentation. So buckle up.
Thank you. I hope I can deliver. So yeah. Thank you very much.
Topic. It can get a little dry sometimes because we're talking about long-range planning of large capital projects, but it is exciting. So I don't want to make light of it. Kyle, take it away.
No problem. I'm going to share my screen as well. So I think that's up and running. Thank you very much, Kyle Schneiderjohn, the Director of Capital Projects and Development Engineering, and thank you, Mayor and Council, Mr. City Manager, for the warm introduction to this topic. The Community Investment Program is what we're talking about today, and so I'm introducing the topic. You, council members, have the big book was part of your packet, and we'll talk about a little bit later on in the presentation how that's available to the public to review also. But basically, this is an introduction of that document and the start of the conversation that then we'll move forward on. So what is the Community Investment Program? What is the CIP? This really is a guidance document for staff and for the citizens, even investors into our city. It's a guidance document that helps outline what things we're going to be investing in and what we see as needs and priorities for our community. It generally is a document that the department heads and management team and elected officials help put together by starting out there with citizen engagement and reviewing master planning documents and our budgeting targets and all of those things meld together into this document that helps us prioritize and organize and then ultimately coordinate construction of and acquisition of assets that will be utilized for years and years to come. To talk a little bit about this program, it is our fifth year. We started this capital program in the 2016-17 fiscal year. So this is actually our fifth version of this document, and it does build on those annual budgets. It does build on those conversations about assets that we have, assets that we need to maintain, assets that we need to continue to use. Very proud to be part of this community, especially after that COVID update. It dawns on me, and I love those pictures of our civic center and and the assets that those staff members, the new building that gives them some flexibility to work in. We have such an amazing staff across the board, and this plan gives them the tools to be successful year and across the board. So happy to be a part of that. But effectively, the projects that we're talking about are over period, and year one of those is approved in our annual budgeting process, and then years 2 through 5 are not approved in the fact that they actually have physical money assigned to them. They are a plan. They are an outlook on the priorities and needs of that staff moving forward. So one of the things I would brag then and like to highlight maybe as an update to you guys is, again, as the fifth year of this plan, I am really starting to notice and see a benefit of the proactivity that is embedded in this plan, such that our department heads are beginning to start to be able to use things, other tools that they've had at their disposal that maybe they just couldn't get moving forward. And those master planning documents, those studies, those plans that they in the past, maybe even we've bought them before, or we've had this done, and they just couldn't get over the hump to implementation of some of those things. And this proactive outlook really is we're starting to see those plans be implemented into this program. So I'm very happy to report that. Oh, wrong direction. So where are we at? This is basically the funding history of our previous 5-year plan. Over the last 5 years, we've authorized the expenditure of $436 million in capital assets. And in those categories there you see on the right is how they're organized here. The big bar in the big green bar in the middle is our bond proceeds that has been made up significantly out of the Proposition 1 and Proposition 2. Our drainage, we had some drainage utility bonds issued in that time period as well. And then the next kind of big bar in the chart there is that kind of light blue, which is our water and sewer, our big enterprise fund expenditures such as wastewater treatment and water treatment was always kind of have lasting impacts across any capital program. But that's what it looks like for the previous 5 years. And then our future 5-year outlook looks like this. And so you kind of start to see the bond projects tapering off there as we get our Proposition 1 and Proposition 2 projects fully implemented and fully the funds allocated for those projects. Then we kind of roll back into a more conventional non-bond program capital scenario where those enterprise funds kind of start to dominate the chart there. But that's moving forward in the next 5 years is an authorization. And what this plan is asking of you guys to evaluate is a 5-year plan to allocate $289 million in a 5-year capital plan. The chart here is just a numerical representation of the last chart, and so that kind of gives you some volumes there, if you will, or some depth to those numbers and what we're really talking about. Those bond proceeds are going to see an issuance of $55 million in this year, which will culminate in a large amount of roadway construction for the summer, for this upcoming summer. We will be finishing up a very large street maintenance project, as well as undertaking multiple arterials and arterial reconstructions as we move forward. I do want to highlight two things as we physically talk about the numbers. You can observe it in the same way on the chart, but as you guys take this home and go through the information and think about it and look at it, there's two things I do want to highlight. The first being our airport, the airport dollars here over the last. That's a pretty decent number. There's some numbers out there in the future or in the middle that are federally funded grant dollars for the airport. And we know anytime talking about those federal dollars and will we receive federal dollars, as in column or row number 2, the federal grant and aid. We see those predictions of federal dollars out there in year 3 and year 4, and those predictions, those are future allocations that have not been finalized. But when we start talking about federal grant, and specifically for the airport, we needed to true up our capital plan with the capital plan, say the FAA and or federal, other federal organizations, some transportation funds, and those they have 10-year outlooks, and we needed to true up our capital plan to those federal outlooks, and that's what this does. So they are projections of projects that are needed, but those are not guaranteed funds out there in the future. We cannot commit to the receiving that grant or that federal aid. Especially when we're not quite positive what the federal aid structure even look like three years from now. So keep in mind that this is a planning document, and so that helps remind us that as we move out into years 3, 4, and 5, we move from a construction priority to a project on a scale as we move out into those future years. So I hope that makes sense. So where we go from here. So obviously you guys have your books in front of you, and they will talk about being made available to the public. But we're basically aiming of an ordinance that says, hey, we support this planning document, and that direction from you translated into directions to your department heads of let's move towards these priorities. We will have our first public hearing on January 26th, which is the next time this group is together, and then we're aimed at the second public hearing on February 9th. The department heads and myself and the design staff are already moving forward with the year 1 projects that are presented in this, as those projects were part of our already approved annual budget. But then we immediately will roll right over and start looking at those future year priorities. What do we need to be doing to prepare for those projects, and also identifying the next needs and the next items to be included in next year's CIP.
Kyle, can we go back to the slide that was previous? Just some of the numbers, and go over some questions now, or do you want us to wait until the end of your presentation?
It doesn't matter. Let's do it right now.
Can you walk through one? You have highlighted it, but I just want to be sure our community is aware that when we get to that year 2022, 23, that those bond proceeds dry up. Those dollars that we have been using to do a lot of projects, there will be no more issuances at that time. I'd like to get an answer on the water and sewer utilities in 2020-21. It's almost double than the next year. Can you talk a little bit about why the big drop off? And in general, this 2020-2021, we're talking about a 5-year plan, but we're already in 2021. So this is what started our current budget, correct?
Yes, ma'am. So that column of 2021, those expenditures were approved in the annual budget. And then the consideration for this plan really does start in that 2021, 2022, and or year 2, and then the next 5 years after.
So I guess my 2 line item questions have to do with the water and sewer utilities, why it was double this year's budget versus almost half of that in your projection for 21, 22. And then also on the drainage utility, of where it was only $40,000 this year to then $2 million for the next 3 years and a $7 million in the 5th year of this plan.
No, great. That's a great example. I started to use that example instead of the airport, but so I'll highlight exactly what you're asking. So let's start with water and sewer. The issue, or the numerical difference in water and sewer, is that we in year 2021, there are bond proceeds. The drainage utility is through a revenue bond scenario, where that department is issuing has that they're borrowing money, and they are fully making the payment of those on that loan or those bonds of the department. And so the difference between year 1 and year 2, and or 2020 and 2021 and 2021, 2022, is that you see those bonds roll off. So in the year 2, 2021, 2022, the 8.8 million is more in line with what they with what the water and utility department can support capital wise without being in a bonding scenario. And then as they move out in further years, the department is starting to then project some need, and they're forecasting to us that we may be in a scenario where we're entertaining an additional bond or other funding mechanism that they would be coming and asking for that authorization for. And that is a very good example of the drainage utility as well. When you dive into your plan and you start looking at the big table of what the drainage utility is going to spend, there's $10 million of a direct bond that is supplementing the drainage utility in year one. Their capital budget is $10,040,000 rather than $40,000. That those dollars are included in that bonding value, and you'll see that when you actually look at the department's breakdown in your book. And so their department, their revenue, based on being an enterprise fund, based on people paying that drainage utility bill on their water bill, can support somewhere around $2 million worth of capital in any given year. And so in this year, they were utilizing that revenue to support a revenue bond. And then we see the equalization of that over the next couple of years where they're basically saying, no, we're not going to go out and borrow anything else. We're just going to spend what we have cash to handle and what we have cash to invest. And then when we slide out towards that year 5, they are starting to forecast to us that, that will not meet our needs. Spending $2 million based on the revenue of our department will not meet our full future need, and they are forecasting to us that they will be looking for future funding of some mechanism, and that's not identified at this time. We could go for a bond. We could seek. We won't see transfers from the general fund of $7 million, but we could seek other funding sources from other mechanisms to support that. So that's that transition from year 1 being an actual physical project that is going to be constructed to a prioritization of projects out to even in year 5, we were identifying that this is a projection of need. Does that help?
Yes, thank you, Kyle. And I know you stated this, and I just want to repeat it again for our citizens listening, that it's this 5-year plan. It encourages our departments to be taking a long-term view and being prepared and kind of seeing what's on the horizon, but it is only funded 1 year at a time. It is approved by councils in that annual budget 1 year at a time, and it is flexible. Even though this council would approve a 5-year CIP, a next council is able to reevaluate that and change priorities, shift things around inside those categories 1 year at a time.
Yes, ma'am. So to continue the conversation and an indication of getting the public and having them have their input, the web address at the top of the screen is where this document will physically be posted on the City of Amarillo's website. But the simplest, if you don't want to snap a picture of that with your phone real quick or watch this later and pause it and type all that out, the simplest absolute way is to go to the City of Amarillo website at the departments. And within departments, you're going to go to the finance department, and there's a financial informations page in the finance department of the Amarillo webpage. This draft document will be posted right here above the previous year's community investment programs. As you see, there's the last 3. The 16-17 isn't up either, so that, because I did say this was the 5th iteration of the plan. The draft will be posted right there at the top of that list for the community to take a look at, to dissect, and ask questions if they wish. So that is all of my presentation, and I'm happy to entertain any further questions that anyone might have.
Any further questions for Kyle, Council?
So Mayor, I had a question on timing. So with this presentation, the recommendation of the CIP, then when will we be voting on that and just having an opportunity to kind of look at the breakdown in some of those individual departments of what those projects are? Will there be further discussions, or will we be, can you just follow up on what our next step is with this?
Yeah, I think we had 2 dates in the presentation. One is the 26th for possible first approval of it, and then February 9th would be a second step. It's going to take 2 votes because it is an ordinance. And so council has their big books, and you guys can flip through there, come prepared with more questions on January 26th, 2 weeks from today. In the meantime, though, it is always an option for you to reach out to Jared and ask for more information, ask for a meeting. Anything in the book that you have questions on, you want to work those questions prior to that meeting, that door's wide open. Am I right, Jared?
Yes, ma'am.
Does that tell you where we're headed, Elaine, as far as timeline? Okay, good. Thank you. Anybody else have questions for Kyle? Okay. Kyle, thank you very much. We appreciate all the work that goes into putting that together, and glad to hear that you guys as staff are beginning to see the benefit of having it as a tool for the long-term planning, because I agree with Councilwoman Hayes that that is really a benefit to our city to have that long-term view. So good job. Item 1E on the agenda is a report from the fire department on its accreditation strategic plan.
Right, Mayor, we've got Fire Chief Jason Mays, who's going to introduce the topic and then hand it off to Chief Mason. Chief Mays?
Good afternoon, everyone. Hello, Mayor, Council, City staff, and anybody watching at home. It's my honor and privilege to present Deputy Chief of Operations Brandon Mason. He's been assigned the role to coordinate, overseeing our achieving of our strategic plan goals. So I'll turn it over to Chief Mason.
Thank you, Chief Mays. Thank you, Mayor, Council, for the opportunity to share this a brief overview of our strategic plan. As you all know, this is an annual requirement. We just want to give you an update from the last plan that you were actually a part of. The 3 pillars that we look at for when we're viewing our accreditation: take a look at our standard of cover, and then we also have our what we call a FESM, Fire and Emergency Service Self-Assessment Manual. Man, that's a mouthful. And then finally, we've got our strategic plan, which we're going to look at today. The strategic plan is going to be comprised of 8 different goals, and I just want to briefly touch on each one of these goals, just to give you a brief overview of kind of where we're at. Again, at any point during this presentation, if you got any questions or concerns, please stop me and we can look at them one by one, or at the end, I'd be happy to entertain any questions that you may have. Goal number 1 is to improve our internal communications and support the department's missions and values. This has been easier said than done based on all the COVID situations that we're currently dealing with, much in the same way you all are having to revamp any of your procedures. We're telling our personnel to stay apart, try to distance as well as they can, but we're still needing to convey important information to them on a daily basis. Meetings to a virtual platform via Zoom. We've also been able to look at each one of those by shift and incorporate not only when we were just getting an officers group together to visit about key topics, but we're able to visit with the whole shift at one time and or the whole department if need be. Some of the topics that we dive into, a little further explanation. So we're able to take video messages from staff and put them out to the masses and further explain things in a maybe a more suitable platform. incorporated our local 542, which is our employee union. And in the past, those relations have been somewhat strained. We've taken a proactive step to meet quarterly with those folks to try to work out solutions with Chief Mays, Chief Bacham, and myself with their executive board and try to build and maintain that rapport so that hopefully we can discuss any of these issues before they blow up to a point that none of us are happy with. Moving on to 2, and that's going to be to maintain and improve an effective and to support the department's missions. As you're aware, again, much of our job is based upon being around each other. For any of these things that we can do to keep up our annual CE program, we want to make an effort to try to keep a software platform that's suitable for our internal needs. Those can be anything from just our annual recurrent training to any type of compliance that may go along with that. The content can take us from incident command all the way to EMS level training, so it's very versatile in what we're able to do. Also, we've worked with human resources to deliver any of the HR specific content that we may need to view those as well, all in one platform. As always, we're looking for new and innovative ways to keep our training costs down. These include trying to work through some in-house recruiting, being that we could increase our diversity, as well as always looking at increasing our level of EMS trainings to hopefully keep the city as safe as we can. Amarillo College is a valuable partner that we've had with this process over the last probably 20 years. With working with them, it does present its level of challenges at times. They are the main provider of firefighters for our department. Once they get trained up by Amarillo College, they come in and we're able to hire them off of a civil service test to be able to put them to work. We also have been meeting with the Amarillo College deans to discuss any curriculum changes and try to pick up any issues before they're actually a bigger problem. Our goal number 3, again, hinges back to our EMS provided capabilities to better serve our community. In 2020, we're able to put forth a EMS mobile classroom, and what this is a decommissioned ambulance that we're able to put advanced levels FTO, field training officer personnel, out there to run to each station, and we're able to work on advanced level skills that would normally require a classroom and more people gathered together, and we're able to put forth these efforts to take some of our high-risk, low-frequency events and train on them in a more intimate setting. We were also able to add 2 paramedic engines to our fleet. That's going to be at Station 6 and Station 9. Both of these trucks carry many of the capabilities of what you would find on a standard ambulance, just without the transporting capabilities. So in the event that AMS, our ambulance provider, is out of units, we can deploy one of these other 2 trucks to your location in the event of a critical need and still get the care that we've promised to our citizens day in and day out. As we continue to have more paramedics graduate our training program, we're able to hopefully explore more options for more paramedic engines on the streets. Goal number 4 is to interact, educate, and inform the public on what we do and try to improve our transparency and visibility. Again, this has been quite a challenge to still reach our target audience most years. We've some virtual station and virtual truck tours. These can be instead of bringing the kids or to our apparatus, we're able to put forth the same little different dynamic on the material is going to be delivered to them. We've also looked to try to create all of our content digitally, whether it be fire extinguisher training, any of the like, and we want to try to work toward updating our website to allow all that content to be available to our entire audience throughout the region. Again, these are not as ideal as we would prefer to have them, but in our trying time, this is a very good way to still keep connected with our audience. We also have increased our socially distanced activities. That included driving around with some off-duty personnel with Sparky the fire dog to notify neighborhoods when the truck would be out and available in their area. The kids would come out, be in the yards, and we were able to drive by, wave at the kids, and they were able to see Sparky much in the way that they were used to having some interaction with him through the schools over the school year. Goal number 5, we're looking to develop a greater sense of oversight, management, and planning of physical resources and technology to ensure fiscal responsibility and future sustainability. Internally, we have asked each one of our program managers to start prioritizing their program budgets, much in the same way of a zero-based budget, but offering them up the ability to prioritize any needs that they have, followed by wants, and then if there's any funding left over, actually tackling it from a wish list approach. This has been successful not only in the sense of trying to adequately figure out where the flow of the finances are going, but it also gives the program managers more buy-in to be able to process works. While we're doing this also, we're looking to try to incorporate our long-range planning with other city departments. As you're aware, it's very difficult to do this just within our vacuum of just the fire department. We have to look at and hinge on all of our other teammates in these matters to try to make sure that we've covered all our bases when we're trying to look at incorporating a plan for the future growth and development of the department. We've also looked to implement a stronger inventory tracking. Many of the items that we have are quite expensive, and by allocating each one of these resources to the individual, as well as looking at station supplies and the like, to try to figure out what it actually takes to run one of these stations for the course of a day, a month, a year, so that we can better account for the track resources. Goal number 6 is to look at the enhanced workforce development at all levels to better serve our community. Chief Mays is a member of the Amarillo College Curriculum Board. This interaction has allowed us to have a voice in how our firefighters are trained for the future. Again, AC is the primary provider for our fire department, so we're continually looking at ways that we can improve our diversity through AC. Some of these, we're looking for community leaders for the underserved areas, whether that be a school, a principal, local pastor possibly. Someone who has a connection with some of these kids that we can kind of funnel them in a direction where we can help guide them through Amarillo College and hopefully get a successful applicant to someday come work for the fire department. Some of these things, again, that have been hit by COVID a little hard is our high school interns. While many of the things that we do are hands-on within our department, it's been an avenue that we're still able to connect with the kids, answer some questions, work with their teachers that have them usually assigned to the stations, and try to incorporate a better plan to try to get them connected up where they need to be. Oftentimes, these kids are left with we could be a last resort for them to enter the workforce, and we definitely don't want to take that for granted, even in the sense of COVID times like what we're in. Goal number 7 is going to be develop a strategy to build and maintain an effective workforce to support AFD mission, values, and vision that reflects the community that we serve. Chief Bockham, myself, we have been assigned to a staff resource committee, and what this is looking at is to try to find ways for professional development within our organization. One of the ways, whether this be with the CPSC, which is an agency, there's different types of paths, learning paths that can get these certifications to hopefully increase awareness of the accreditation process, as well as make us as professional as we can be. Going to build relationship with community leaders. When we started our accreditation path, this was a valuable component. We were able to get a vast array of our community, a very good cross-section, to come in and actually allocate what they felt was important, and we were able to build our plans around those thoughts and visions from our public or from our citizens, which are ultimately our customers. We continue to work with Amarillo College on how to attract a more diverse fire academy. And again, while we're limited, having to work with a third party, those conversations still are ongoing. Each time before we open up a new, whether it be a day or night academy, we try to visit with the deans at Amarillo College to see both what we're needing in the way of student population and what they're able to provide. And again, this, while less than perfect, we're attempting to meet the need to focus on ultimately better course. Goal number 8 is to achieve our international accreditation. We have, since this last update to you all, science manager. He will actually, this team will be led by District Chief David Koba and his team. They will be looking at the accreditation as a whole, the insurance safety organization, and the policies and procedures that go along with the department. As of the reporting of this presentation, we have been able to maintain our 2020 accreditation, and again, continue to look to strive and keep that 2021 fresh on the heels of 2020 so that we can continue to make positive strides within our community. All of this goes without saying, but thank you all for your support for public safety. Many of these items would not be possible without your continued support, and that goes for city staff as well and the rest of the departments. It's definitely a team effort within the city of Amarillo, and we certainly appreciate everyone's efforts. And that concludes my presentation.
Council, do we have any questions about the update? Well, Chief, I really appreciate you and the work that you guys are getting done at the fire department. Definitely one of the things that citizens talk a lot about, the service that they get, because when they're in need of your services, you guys come. It's very humbling to be on the other end of that. So we appreciate the long-term vision for making the department better, but we certainly appreciate what our firefighters do day in and day out to keep our city safe.
Thank you, Mayor. I'll certainly pass that along to the rest of the department.
Thank you.
Thank you.
Okay, moving on to item 1F is an update about Thompson Park Pool.
Hi, Mayor. We have been moving through a number of pretty meaty informational reports this afternoon, so I appreciate everyone's patience. This is good stuff, and this is another one of those items. Michael Kashuba, Director of Parks and Recreation, is going to update us on the progress of the Thompson Park Pool. I know this has been a project of a lot of interest, and bottom line up front, on time, it's under budget. Michael, take it away.
Mayor and Council, Michael Kashuba, Director of Parks and Recreation. Excited to provide a construction update on obviously the new pool. So what I'd like to do is just to walk through a few slides and then open it up to any questions. So I'm going to go ahead and screen share. So before we get started, I wanted to just kind of provide a final rendering. So this was the rendering of the project. Again, this project and the plan were based on the significant response that we got to the Thompson Park survey. We had over 1,400 people respond to that survey. And some of the things that we heard in the survey were lazy river, number one priority. The community did not want lap swimming. And the community also wanted more of an aquatic style, park style facility. One of the things that we've added that we felt is more experience is just more open space. So that there's a lot of grass areas where people can come without being kind of crowded on the deck. So as we look at the plan, the large pool, number 11, just some of the amenities that are going to be included there are things like the zero depth entry. You can see right there at number 10, there's a large entry area. There's a lot of independent water features and geysers. Number 13 is a sun shelf, and that's an area where we will have some lounge chairs in the pool that are about, the water's about 6 inches deep, so people can actually sit in the water, also in their lounge chair. We've got some benches that are located kind of in the circle area, area 11, where people can sit in the water and kind of observe. We've also got the large volleyball area, number 12, so people can actually play water volleyball. There are some basketball goals that can be put in between number 11 and 16. And obviously it is accessible to the community, so we have accessible entries into the facility. As we look at the lazy river, a couple of the things worth noting there is you've got an 8-foot wide channel. One of the reasons we like the 8-foot wide channel is that it allows us to be adaptive in our programming. So one of the things that we are looking at programming is kayaking. The radiuses allow us to be able to put a kayak in there so people can get some resistance training if they're on some trips to either Colorado, New Mexico. There's going to be some times where people could go use that for that purpose. There's also some sprays, obviously some pipe falls. There's a hydro jet, so you can sit in the water and there'll be some jets in your back. The vortex, and obviously this facility is also accessible. So that's aquatic features. We also have our 2 slides, and on the image here you can see number 7 is a storage building, 6 is our ticket and staff area, and number 5 is your restroom and concession. Number 9, and you'll see some of the construction photos, is the pump house. That's where all the plumbing and piping for the facility occur. So with that, I'll step into some construction photos. So this is an aerial, and one of the things you'll see in the bottom right corner is a key map. We've put an arrow that kind of shows the angle that you're looking at, or the view. So this is a view looking actually to the north. So you can see the leisure pool right there in the front of you. You can see the area, the finger area that's going to be for the volleyball. Over to the left, you can see the slab of the storage building, and then right where that trailer is the footings for the rest of the buildings. Those footings are in place, and in the near future, we're going to start going vertical there. Directly north of the leisure pool, you can see the lower level of the pump house. That's currently being formed up, and there'll be a concrete pour in the near future. And then you can also see the lazy river. This is a view if we flipped and look the opposite way. So you can see the lazy river right below us at the bottom of the screen. Those big boxes are the drains. So all the drains, piping, all of the infrastructure below is in place. The process is you put the plumbing in, then you put a level of crushed rock in there, and then on top of that is the rebar. So you can see for the lazy river, all of the gravel's in place, the plumbing's in place. The next step is going to be the rebar. So this is a view looking more to the east. So this is the leisure pool itself. You can see the construction crews were out there putting in the rebar. This was taken on Friday, so I anticipate that this pool is completed for the rebar, and they are going to be shifting over to the lazy river. Plan is for all the rebar to be in place. There's going to be a group meeting on Friday and an expected concrete pour of the main slabs on Monday. So all rebar is in place, and we're going to start pouring concrete as early as the start of next week. This is another view of the leisure pool, more from the side. You can see again kind of where that sun shelf is going to be. A lot of that rebar is in place, and again, we're just getting ready for the construction pours. You can see in the background at the very top, there's a bunch of plywood stacked up. Those are the concrete forms. So once that bottom slab is poured, it won't be long before they start putting up the forms and pouring those side walls. So we're moving forward with obviously the bottom pour, but then those side pours won't be too far behind. This is a view of the pump house. This has been an item of a lot of coordination. There are a lot of sleeves and a lot of pipes, large pipes going into this room. So this is something that we've been working on. The structural engineer was on site yesterday, and the goal is to pour that hopefully in the next couple of days. So the form boards will be going up on the outside, and that pump house will be poured. Another view just kind of showing the number of sleeves and also the size of those sleeves. When you look at the workers that are on site, it's a lot of plumbing and a lot of work that needs to go into this. This is a view if you're looking from the restroom concession building to the north. So you can see the concrete slab at the top of the picture is the storage building. The area right in front of us where you can see all that conduit, that is going to be the IT connections and more of the ticket office. There is a lot of conduit. We have got all basically the footings in place. The plumber electricians are working on getting all of those stub outs and the conduits in place. So those conduits are going to run everything from our lighting connections to our IT connections, camera connections. So there's a lot of coordination that's going on, and we're getting really close to finishing that up. Once that's complete, the board and then the buildings can go vertical. One of the important things to note is if we go, we'll talk about it here in a minute, but the special event space is something that will be a standalone project. What we wanted to make sure was that all of the conduit was in place to facilitate that as a separate project. So we've done a change order that allowed and extended all of those conduits out that would basically be in place for that special event space. Again, this is just another picture of the conduits going through and back to the pool area. So again, very, very high level. We're still on schedule to be completed before Memorial Day 2021. We're still in budget. The total project budget was $8 million. The contract amount for Wiley Hicks was that 6.218 number. And something worth noting is that special event space is going to move forward. We are just going to be doing that as a standalone project. So, and one more thing to include is that total project cost includes everything from design, construction, furniture, fixtures, and equipment. So that's the total budget for this project. With that, I'd be happy to answer any questions.
Hey, Michael, does that 8 million or that 6.2 million, does it include the demolition of the current pool?
That does not, but that would be included in that $8 million.
Okay. Okay.
So in that $8 million is funds for the demolition of the existing structure and also the construction of the special event space. It wasn't advantageous for us to add it to the current contract, so we will be doing that as a standalone project, either as a separate bid or through facilities.
So what is there a plan for where the demolition occurs of the old pool?
Currently not. The plan would be to basically remove the structure, backfill it, and just put turf. So restore it back to more of a natural condition, but there's no plans aside from that.
Well, actually, that seems like a plan to me. That I just wanted to see, are we going to at least make it turf so that it could be usable again, or what was going to happen? So you answered it perfectly. Thank you.
And just as a side note, there's been a lot of dirt on this site that's had to be moved because of the pool size. So we're actually stockpiling that behind the zoo for future use. So when we mow that existing structure, we can use that dirt to backfill. So it'll reduce those costs.
Great.
Other questions for Michael, Council?
Michael, do you have a time frame on that demolition?
No, what we want to make sure is this project gets done first. Finish this, make sure we're done with this. Because there are, as a part of that second project, the special event space, right here on the screen, you can see area number 8, the right side of your screen. There's a significant amount of dirt that would be required to get it to grade. There's about a 7 or 8 foot grade change on that bottom corner. So we want to make sure that we use that dirt there first before we start doing the demolition and that other site.
Thank you.
We appreciate the diligence you guys are putting toward this project. I know a lot of people are excited about opening this pool in May.
Yeah, we're excited.
Okay, Council, I had thought we would make it all the way at least to consent, maybe just past consent before we needed a bathroom break. Anybody need a break? Can we do this next item and maybe get to consent? Okay, let's do that then. Item 1G is a presentation on speed limit changes at Loop 335. Mr. City Manager.
Hi, Mayor. We will move in a workmanlike way. We've got Assistant Director of Public Works, Donnie Hooper, here to present the item. Donnie?
Thank you so much, and Happy New Year, everyone. Mayor and Council, it's good to be with you here to present this item today. I want to share my screen, if I can find the right screen to put up there. See that? This is a presentation today to talk about an ordinance change coming your way, a request change that will come your way next week, or sorry, at the next council meeting. And this is actually something that came to us from TxDOT and TxDOT right away. But since we have the ordinance within the city limits, we of course have to bring that before you. The purpose of this presentation today is just going to give you more information about the changes and of course that ordinance about the limit for Soncy, Hollywood Loop 335 from Soncy or from Amarillo Boulevard to I-40, changing that from 50 to 40, from I-40 to 34th, from 40 34th past 45th from 50 to 40, just south of 45th to Coulter from 60 to 50. And TxDOT's going to be submitting this information once it goes through council, as they normally would, to the Texas Transportation Commission in February. And I might also mention that Wes Kimmel is on the meeting today. Wes Kimmel is with the TxDOT Amarillo office and actually a former friend of mine. He was the area engineer in Pampa when I was over there. So good to have Wes with us if you have any questions for him. This is the existing speed limits. You can start this is from north to south, from top to bottom. You see Amarillo Boulevard to I-40 there is listed as 50. And then the green area at 45 miles an hour between I-40 and 34th. And then, of course, from 34th just past 45th at 50 miles an hour, and then 60 miles an hour all the way until you get to just shy of Coulter Street, where it goes to 55. That's the existing. This is what they are recommending for that change, and this would be changing it from Amarillo Boulevard all the way to 45th to 40 miles per hour, then 50 miles per hour from that location all the way around to where it meets up with Coulter, and then 55 as it goes back toward connecting up with I-27. What has happened in this, in the background of this, is the residents of the subdivisions along Soncy have made numerous requests to the city traffic department as well as the Texas Department of Transportation about the speeds on Loop 335, and that prompted TxDOT to, of course, do a speed study in that area along the corridor. Once they completed that study, they did indicate that the speeds on that corridor had dropped below the posted speed limits along Soncy and Hollywood. And it might be worth mentioning that they use the 85th percentile of traffic. If you're aware of what that is, it's basically saying that 85% of the vehicles that they studied were traveling at a certain speed on there in order to feel safe. And that has changed a lot over the years because of the development that's occurred along Soncy Street. That's the reason why the average speeds have probably dropped on that corridor due to also heavy traffic that's in that area as well. There's several factors that play into that, but when they did their speed study, that's what it revealed. Other traffic factors, the traffic signal, as you all know, is going to be installed at the intersection of Soncy and Perry. That's going to be taking place sometime in the early spring when we get that in. Traffic speed study will also be completed after we put that traffic signal in to see if the speeds are aligned with the new speed limits. And we don't anticipate, in talking with our traffic engineer and our traffic department, that we will see any areas of change there along Soncy once these changes are made. City staff will be sending out press releases next week to notify the public of the proposed ordinance that will come before council. We'll also, if the change is approved by City Council, we'll get with TxDOT and we will send out media releases to inform the public of any changes that take place on that corridor. TxDOT has requested the City of Amarillo Council proceed with the passage of that ordinance, again, with those speed limits that we just listed, and we'll bring that to you as an action item in the future. Any questions, I'll be glad to answer them, or again, as I mentioned, Wes is on the call and he could probably answer it as well.
So, Donnie, this project is basically being driven by the citizens, right, that are in that area?
That's what prompted the original study, or this recent study, to take place, yes. Okay. And then I just have one other question. Can you explain the 85th percentile rule, I guess, how that works? Or yeah, I'd be glad to. The definition of it is traffic engineers use 85th percentile as a standard to set a speed limit at what the public would consider a safe speed, of course, to minimize crashes, to promote uniform traffic flow along any corridor. Now, with the definition of that, it would seem that the posted speed limit would be highly influential in determining what the 85th percentile speed is. But really, it's actually the opposite of that. As you dive into the percentile rule, it helps to reveal why it's a major consideration in determining the speed limits in those areas. The speed defines the 85th percentile drivers that drive below, under free-flowing conditions, the speed limit that's posted. Most people don't drive according to the posted speed limit. We usually see that about 15% of those people would limit, and so you want to set the speed in that 85th percentile so that they have, it's based on the feel of the street so that the motorists there feel safe as they're traveling down that corridor. And there are many things that can influence that change in traffic behavior, lane show configuration, signalized intersections that were not there before, presence of any kind of curves or anything like that. Also access management characteristics, medians, turn lanes, configurations, and things like that. So basically, I hope it answers your question that this is really just traffic behavior that's observed to see what they're doing. 85% of the traffic is doing in that area based on what they're comfortable with.
And the reduction,
it does, Don. I appreciate that.
The decline in the speeds is Donnie mentioned it, traffic volumes. Congestion is driving it as much as anything, and that does not yet reflect the traffic signal that's going to be in there soon in that area.
It might also be worth noting, too, that we know that once this goes into place, we've already begun to be proactive in the areas around that, such as Coulter, 45th, 34th, Hillside, the areas that connect up to Soncy, because we want to make sure that we're going to stay in line with that, too. So that's something that we're studying as of right on speed changes as well because of this.
There's also some moving parts here because as we finish, one of the primary reasons we've received the amount of funding we've received so far for the Loop 335 project is because of the safety benefits that are going to be represented by that. That access controlled area road is going to take a lot of volume off of Soncy, which has a number of accidents on a regular basis. The same is true of I-27. It's going to relieve volume off of I-27 north of Hollywood through downtown. So there is going to be significant safety benefits that will affect the volume of traffic on Soncy and 27. We're not talking about 27, but there's a lot of things that are changing how people are going to be driving over the course of the next handful of years.
Any other questions, Council? Okay, Donnie, thank you very much for that update.
Thank you.
Item 1H is to request future agenda items or reports from the city manager. Council, do you have anything today that you want to request? Okay, not hearing anything from anybody. Then I think we can move on to section 2 of the agenda, which is the consent items. But before we do that, let's take a break and come back just in 5 or so minutes. Mr. Bartlett, please. Oh, he did. Okay, well, thank you. Bye-bye. Huh. He called me. Huh. Okay. I think we're ready to move on then to consent agenda. Anything there, council, that needs to come off before we take that item up for consideration? Okay, not hearing anything. Anybody want to make a motion to approve the consent agenda?
Yes, Mayor. I move to approve the consent agenda as presented.
Second.
It's been moved by Councilmember Powell and seconded by Councilmember Sauer to approve the items on the consent agenda. All those in favor, please raise your hand. That item passes with a 5-0 vote. Moving to section 3 on the agenda, item 3A is consideration of ordinance number 7897. Mr. City Manager.
All right, Mayor. In previous meetings, as we were discussing in November, the appointment of individuals to boards and commissions, Council had asked for us to prepare a draft ordinance, a modified ordinance that would allow Council some flexibility where in situations where it benefited the city or the Council saw a unique benefit to the city, that they had the flexibility to appoint someone who was not a resident of the city or a registered voter of the city. So we've made some very simple changes. If you have the ordinance in front of you, ordinance number 7897, in agenda item packet A, you can see underlined in the first paragraph, or in paragraph 2-6-3, the qualifications, down towards the bottom primarily, but in a number of locations as we changed boards and commission, we added commissions to the boards. It says, while registered voters of the city will be preferred, the council may appoint any person not registered to vote in the city who brings exceptional subject matter knowledge or expertise to serve on a board or commission. One of the things about the boards and commissions, they do not have direct authority to spend any money. I know that was one of the questions that had been asked previously. We do make recommendations to council. The spending or authorization of spending is either done through the budget or done through unique requests to council for things that are exceed $50,000, like construction projects or things like that. So this addresses the desire that was expressed to give council that flexibility. It also captures the intent that the preference is for a resident and registered voter to be representing the city and making recommendations to council through these boards and commissions. However, it does give you the flexibility to utilize someone who's not a registered voter of the city if they bring unique benefit to the city and if you determine that they bring unique benefit to the city. With that, City Attorney Brian McWilliams was instrumental in creating it. So if you have any questions, I or Brian will answer those for you, or anybody else that we have that might be needed.
Questions, council, for Brian or Councilmember Hayes?
Yes, Mr. City Manager, I just wanted to ask if you were aware of any other cities that have this exception, or if cities' policies are restricted to boards and commissions being citizens of a local community.
I am not. We have not done an exhaustive research on it. Brian may have more information, but in my experience, in the cities that I've worked in, there have always been requirements for representatives on boards and commissions to be residents or registered voters of the city.
That has been my experience as well.
Thank you.
Any other questions for Brian, council? Okay, do we have a motion on this item, which would then be followed by discussion?
Yes, Mayor. I move to adopt ordinance number 7897 to amend section 2-6-3 of the Amarillo Municipal Code to allow for the appointment of persons who are not necessarily registered voters of the city to be appointed to various city boards or commissions if they possess special expertise or knowledge related to the board or commission's operation and or charge.
Second. Okay. Councilmember Powell has moved to approve the ordinance, and Councilmember Smith has seconded the motion. Any discussion on this motion?
Mayor, I'd just like to say I appreciate having this conversation and the staff preparing and giving us an alternative, and just sitting with us, looking at comparing to other cities and the fact that as far as we know, other cities don't have this exception. I think there is a reason. And I think it is important that people that are speaking into the activities of our local community are our residents. We just saw how many local residents we had apply that we didn't even have enough slots for, that we had to reject multiple applications. And so I am not in support of the change. I think it's been in place for a long time. I think it has a reason for being there. I understand the discussion and wanting to consider the alternative, but I think it is a good position for a community to reserve those spots on those boards and commissions for local voters, property taxpayers, and citizens of your community.
Any other thoughts or discussion on that? Thank you for sharing your thoughts, Councilwoman Hayes.
I'd say the sentence that's underlined in there, I think, is important. I'd like to stick mainly to people that are registered voters in the city. But where I think we can make exceptions is where there is subject matter knowledge or expertise that would serve the city well. So we'd have to decide that at appointment time in each November when we appoint people.
I think I'm probably going to be along the same sides with Howard. I really fully expect for us to rarely see this being used. I think there are going to be some special times when we're going to have someone that we need on a specific board, and they've got some special expertise, and maybe they live in Greyhawk, or maybe they live in Tanglewood, or something like that. And so I think that we just need to be able to have that availability. I don't think it's going to be it should not be. I think the ordinance makes it very clear it's not supposed to be an everyday event. But I think when we have an exception, we need to have that ability to use that exception.
Any other discussion? I think I heard you, Dr. Sauer, making a good point that we have people that are part of our community that don't live inside the city limits. And I think that is a distinguishing factor about us we are the central, really the only city for 26 counties of our size. And yet we have a lot of interest and expertise available to us and have had people apply who live in those 26 counties. So I think it would be the unique, rare occurrence for us to appoint someone. But I think that is what makes us different than maybe every other Texas city, is that we are the regional hub. I don't know. I think that's something to consider. Anybody else? Okay. We'll call for a vote on this motion then. All of those in favor of the motion to approve ordinance number 7897, please raise your hand. And those opposed. So that motion will pass with a 4-1 vote. Item 3B is consideration of ordinance number 7901. Mr. City Manager.
Hi, Mayor. We have President and CEO of AEDC, Kevin Carter, here to present the item. Once he's done, in addition to Kevin and I, we also have Andrew Freeman, Laura Storrs, and everyone else answering questions you have about the zone. So, Kevin, take it away.
Thank you, Jared. Mayor and Council, I bring to you ordinance number 7901. It's a consideration of reinvestment zone number 12. I've been asked by one of the council members to kind of explain the process of why we have to do this. And so I want to do that, if that's okay, before we go to vote. Is that okay, Mayor?
Sure.
Okay, so this is a first step in a 5-step process really to get a project approved in our community. So the first step is the reinvestment zone, the first reading, the public hearing. The second is for our board, if we're going to do a location incentive agreement with that prospect, that's the second step. Our board considers that and either approves or doesn't approve. The third step is the second reading of this ordinance, which will occur on the 26th. The fourth step is the city council considers a tax abatement, and that's why you set up this reinvestment zone, is where you can it allows you to give a tax abatement to a prospective client. And then the fifth step would be the city council would consider the approved LIA from the AEDC board. And so it's kind of a 5-step process, and that's the process we go through. But the reinvestment zone has to be designated for the city or the county or any taxing jurisdiction to be able to give a tax abatement. So this ordinance applies to, this is reinvestment zone number 12. It is for a piece of property that is approximately 110.39 acres in the vicinity of Northeast 24th Street and Loop 335. I think Stephanie has a map for us to show exactly where that property is located. You can see there in the purple shading. It's across from our Centerport Business Park there, just west across the loop from Benny Keith. But anyway, the designating the reinvestment zone is just the step under the tax abatement process under Chapter 312 of the Local Government Code, tax code, that allows for taxing jurisdictions to do tax abatements. And so this would set up that reinvestment zone. This is this would be the first reading. You have to have 2 readings. The posting has to have taken place 7 days in advance. I believe it was done last Monday, so we were 8 days out on that. So that's really the kind of the explanation of what we're doing, is just setting up this zone where the council can consider tax abatement at a future date. So I would certainly answer any questions. Or
Council, do we have questions for the AEDC team? I really appreciated the 5-step foundation, Kevin. Thanks for walking through that.
Thank you, Mayor.
No questions for them? Okay, do we have a motion with regard to item 3B?
Oh, Mayor, before you, can I interrupt you for just a second?
Sure.
I do want to apologize that last time we did this with Zone 11, when we brought up the oncology center, I know there was some there was a mistake that was made on a memo that was sent. It wasn't a legal document; it was just a memo that we were putting a meat processing facility over in the medical district. That was a typo on my part, and I wanted to make sure that I clarified that we are not putting a meat processing facility in the medical district on reinvestment zone number 11. That's going to be a cancer treatment facility. But I just wanted to clear that up. I hadn't really had a chance to clear that up publicly, and so I wanted to clear that up for the council and for the public that's listening, that's going to be a cancer treatment facility on reinvestment zone number 11 that was done a couple of months ago. So my apologies for the typo.
Thank you, Kevin.
And Mayor, we have a public hearing on this one.
Oh, thank you, Frida. Yep, we sure
Yes,
do. Okay, at this time then, let's open a public hearing on this matter. And anybody who is part of this call who would like to speak on, for, or against item 3B, which is ordinance number 7901, you may notify the call administrator. Stephanie, how would you like for them to notify you?
If you are on this call and you wish to make comments in this public hearing, please press your raise hand button in the Zoom app or press *9 on your telephone. Again, that is on your phone or the raise hand button. Mayor, we don't have anybody wishing to make comments.
Okay, thank you, Stephanie. At this time, we'll close the public hearing on this matter and then entertain a motion.
Yes, Mayor. I move to adopt ordinance number 7901, designating certain areas of the city as reinvestment zone number 12 for commercial and industrial tax abatement in the vicinity of Northeast 24th Avenue and Loop 335.
Second.
Been moved by Councilmember Powell and seconded by Councilmember Smith to approve ordinance number 7901. Do we have any further questions or discussion on this motion?
Mayor, I had a couple of comments to make on I do appreciate that when we're doing rezonings now that we do attach that typically to a specific project instead of just blanket rezoning, that it does match with negotiations that we are able to make with potential businesses moving to Amarillo. And my reservation on this, I have some major reservations on just the underlying project and the partner in that project. And my intention today is to abstain on this vote until we are, my understanding is going to hear the final recommendations on this project and the final issues with negotiations and have some opportunity for discussion. And so I'm abstaining on approval of this, a particular tax abatement rezoning.
Because you have a conflict, Councilmember Hayes, or because you don't feel like you have enough information to make a decision today?
I have reservations on the underlying project that it is attached to.
Okay. Anybody else have questions or comments?
Got a question.
Yes, what is your question?
This would be for you, Mayor Kevin Carter. If the whole council went along with what Elaine Hayes is saying, how would that affect the process that we're heading towards?
Well, if it didn't pass today on first reading, then first reading, it would not be eligible for second reading at the next council meeting unless we had a called meeting to reconsider prior to that next meeting.
Okay, thanks.
Kevin, if you were talking, you're muted.
It would push the timeline back, exactly what you said, Jared.
Okay. Is the timeline important to this project, Kevin?
It is. I know that it's a time-sensitive project. I know that that we're going to consider, our board is going to consider part of this project next Tuesday at our regular scheduled board meeting, and then it'll go to council. The project and the tax abatement will go to the council next Tuesday, or in 2 weeks. In 2 weeks, and then it goes to the county on the 8th of February, and then they are wanting to close that purchase of that property either the afternoon of the 8th, because the county will take that up. Potter County will take that up on the morning of the 8th. And hopefully, if it's approved there, then they're hoping to close sometime that week. So I think the 8th is on a Monday. So sometime that week, they would like to get that property closed and make their final decision based on what AEDC does and what the council and Potter County Commissioners Court does.
So Jared or Brian, the action that we're taking today does not bind us to doing the project. Is that right?
Correct.
But we have to take this action if we want to do the project.
Well, no, if we want to, have property tax abatements on this property, we have to have this action.
It gives you the ability to do a tax abatement. So it's just a formalized vehicle for you to be able to do that and to consider it at some future meeting.
Okay. Kevin, if I understood your timeline right, we're talking about 1 or 2 days delay, not weeks or months. That if I followed your, this is the first reading, you have to have 2 readings, and I certainly understand that you were trying to get the second reading at the same time as the vote on the actual project. It would make a first reading on the 26th, a second reading on the 9th, which is just 24 hours past what the goal was for a closing. So it's pretty close.
Yes, ma'am.
But the county will have to wait and come.
But the county, but then it delays that. Actually, it does. That's a good question that Michael brings up. The county can't act until y'all act, because they adopt. If the county so chooses to do a tax abatement, they adopt what y'all do. So y'all have to act first. So then it pushes it back another 2 weeks to the 22nd of February. So good point. Thank you, Michael. Yeah. So the city has to act first. And that's how most of them are structured across Texas. That the other taxing jurisdictions, for lack of a word, they piggyback on top of what the city does. So, or they tether themselves to what the city does.
And would you restate when the next county meeting would be after the Amarillo City?
Scheduled for the February 8th, and it's also scheduled for February 22nd. So it'll be 14 days. I mean, they meet they meet the second and fourth Mondays, I believe.
Okay, thank you.
Any other questions or discussion?
Let me ask another question for whoever can answer, probably Kevin. The prospect that may be coming to Amarillo, they're considering Amarillo, but we're not the only town they're considering. Is that right?
I can't answer that question. Not from a disclosure. I don't know the answer to that, Councilmember Smith.
Well,
I know that they look at several communities all over the country for these projects, but I don't know for sure what competition that we have for this facility.
But if we have any competition, wouldn't it be better for us to move ahead with taking action on this today?
Yes, sir.
Thank you. I made that question easier.
Any other comments, questions? Okay. The motion is to pass ordinance number 7901 and has been seconded. So we're ready, I think, to vote if we're done discussing. Yes? Okay, I'll call the question on this. All those in favor of the motion, please raise your hand. And all those opposed? And I note 1 abstention. So the motion passes with a 4-0 vote. Okay, moving on to item 3C, which is a public hearing. Frida, please help me remember to do that. Regarding our 2021 Community Development Block Grant and Home Partnership Annual Action Plan. Mr. City Manager.
Hi, Mayor. We have Director of Community Development, Jason Riddlesberger, and also just with so much, I want to commend Lilia Escajeda for sticking with us for a long time to be an integral part of this presentation and bringing the recommendation to council for these, but to present the CDBG Block Grant and Home Partnership Annual Action Plan. So Jason, take it away.
Thank you, Mayor and Council. We've presented you with our 2020-2021 CDBG and Home Annual Action with our recommendations that were given by our Community Development Advisory Committee. And like Mr. Miller said, I am very honored to have Lilia Escajeda joining us. And most of you know her, and we're so blessed that she is chairing. And I'd like for her to share with you the process that we went through in order to allocate these funds.
Good afternoon. First of all, it's like coming home. One of the first committees I ever served on was the Community Development Block Grant Committee back in, oh gosh, I'm not going to tell you how many years ago that was, but it was a while back. So it's sort of like coming home. And this is my passion, community development, because that's what I've done for the bank over several years. And so this fits up right my alley. First of all, I would like to commend Jason for helping us process all of this, and also all our committee members who gave of their time and knowledge to make this happen. So there's never enough money, right? Everybody always wants everything quickly, but we have some very difficult choices to make, and we've had to make some difficult choices just because there's not enough money. And in the time that we find ourselves in, these agencies that are receiving the community block grant monies are certainly the ones that are dealing with our citizens who are in dire need of all the services that are going to be provided. So I want to thank that committee for being on top of things and proving and asking the right questions. It wasn't a rubber stamp committee by any means. They all had questions and had recommendations. So for the city staff that does all this work, thank you for identifying some of these items and for making it easier for the committee to do its work. Obviously, the ones that are in the front lines are the people that deal with low to moderate income communities like Catholic Charities, Coming Home, Salvation Army, Panhandle Regional Planning Commission, the Maverick Club, and then the work that you all do for housing, etc. I have to say that I've been on every one of these boards that I've mentioned, so I know what they do. And it's my pleasure to be able to still continue to help. So if there's any questions, please feel free to ask. Thank you for considering the amount that we're asking for the Community Development Block Grant. And again, many thanks to our committee members who helped come to these decisions.
Thank you, Lilia. Jason?
I just wanted to reiterate that great committee. What a fantastic group, and we're so blessed to have Lilia's leadership on that committee. And we did every that pretty much asked for funding was able to receive some funding. We do have Catholic Charities that originally asked for funds, but during the hearings actually withdrew their requests. So that was able to. That's why you see that they had a zero amount there. They actually so graciously allowed that to be spaced out with other groups there. So I wanted to kind of give them a little bit of a shout out there. But otherwise, we've got quite a bit of money that we're able to put into the community, and we're going to be able to do great things with that. So I want to point out our home grant. You see, we've got $720,000 that's there. I'm especially excited about our tenant-based rental assistance, the TBRA. That's going to be a great program. We actually began using that in our last funding cycle and did some great work and able to help our citizens with some of their rental assistance. And we're going to be able to do that to the tune of $546,000. We're going to be able to help some low to moderate income folks that have special needs, whether it's folks that are elderly, also folks that have families that are really struggling during this pandemic. So we're really excited about being able to use that money for that cause. So
I just want to give kudos out to the health department. They've done a tremendous job. I'm calling people in other communities, and some of them haven't been able to get their coronavirus shots, and they have difficulty getting to where they need to go, and some of them don't even know where they're supposed to go. So thanks to the city for making this such an easy transition for people to be able to feel safe.
Thank you, Lilia. We certainly agree with the work that they've done. It's been wonderful, but appreciate hearing it from citizens who are also former council members.
Yeah. Thanks for what you all do.
Okay. Any questions for Jason or Lilia, council? Okay, let's move into the public hearing portion of this item. Anyone who wishes to speak for, on, or against the action plan being presented can do so at this time.
If you are here to speak on behalf of this item in the public hearing, please press *9 on your phone or press the raise hand button at this time. Mayor, I do not see anybody that wishes to speak on this item.
Okay, thank you very much, Stephanie. So at this time, we'll close the public hearing on item 3C and entertain a motion.
Yes, Mayor, I move to approve the resolution to approve the 2020-2021 Community Development Block Grant in the amount of $1,695,314 per the allocated designations and the Home Investment Partnership Program Annual Action Plan in the amount of $720,963 per the allocated designations to be submitted to the U.S. Department of Housing and Urban Development.
Second.
Thank you. That's a motion from Councilmember Powell and a second from Councilmember Hayes. That was quite a mouthful, Frida.
Yes, ma'am.
Any further discussion or questions from the council about the motion?
I had a question for Jason or you, Mayor. Do you remember the dollar amount that the home program, or what we started at? Because this 720,000, my memory's not that great, but that seems like a lot bigger number than what we started with. And if anyone could point out the history on that, I would be interested in knowing where we started to where we are today.
Yeah, I wish I had a good answer for you for that. I can certainly research that and come back with a better answer for you. If you're talking about historically, correct, Ms. Hayes?
Yeah, we cobbled it together at the very start and used that success. And I want to say it was over $100,000, but we used the success of those funds to justify additional allocations from HUD right away. And then that success was used for subsequent annual allocations like this. But I don't have the exact numbers. Jason can get that for me, and I can get that to y'all shortly.
Mm-hmm. But that seems about right. It's about a 7-fold increase from where we started because of the success of that first year. So I think that speaks very highly to the success of this program.
I agree.
Agreed. Any other comments, questions? Okay, all of those in favor of the motion on item 3C, please raise your hand. I see 5 hands, so that motion will pass with the 5-0 vote. Going on, Jason, thank you very much. Lilia, thank you for your patience in joining our long meeting, but we appreciate your service most of all. Item 3D, Mr. City Manager.
Right, to consider resolution to apply for additional funding from the 2020 CARES Emergency Solutions Grant, the ESG grant, to the Texas Department of Housing and Community Affairs, TDHCA. We've got Jason Riddlesberger still with us. We have an opportunity, and it's a pretty sure thing, but Jason's going to walk us through what this short fuse opportunity is, what we're going to do with it with regard to prevention and rapid rehousing. Jason?
Yes, sir. Thank you, sir. So this is our round 2 application for ESG funds through the CARES funding, and we are intending to use that for homelessness prevention and rapid rehousing. The homelessness prevention is just what it says. We're attempting to keep folks from becoming homeless and be able to get them with their assistance with their rent, some past rent, things that maybe they've gotten behind on their rent. We can also use that for security deposits, utility payments, and things like that. And then, of course, we're also going to use for rapid rehousing, very similar, folks that have become homeless and we're wanting to get them back into homes real quickly. And again, same type of thing with rental fees, deposits, those kinds of things. We're going to get them back into the flow of things to help them get back on their feet. And hopefully they're going to have some success with that. We'll continue to help them with a little bit of case management to make sure that is assisting them for a long term, so not just a short term solution. So This is to the tune of $865,799 is what we are applying for, and from all indications, it looks like we're going to be getting something similar to that once we finish our application.
Jason, this is semi-related to this item. It may not be exactly, but with the extra dollars, I know one of the targets we had been aiming towards in the last few years was to move our number of homeless veterans, that number lower and lower, and with a target of having it 0. Do you have an update and related to how these funds, if we could apply it towards that, if we have already met that goal?
We just a great update that I can give you about our homeless veterans is that we are actually basically we can consider ourselves at what's called
functional 0.
There you go, functional 0. So we've been able to maintain that number to call ourselves functional 0 for about 3 months now. So we're doing really good with that. Our committee still meets regularly to make sure that we're continuing to focus on the veterans in our community. We've got some great folks out there that are really helping our homeless vets and making sure that those that we are helping, that they maintain their housing, that we don't have any of them that return to homelessness. So it's working with the homeless and working with folks that have had chronic homelessness. It's a struggle for a lot of those folks, and so it takes a team, and we've got a team that even through COVID, we've continued to meet regularly and make sure that we don't let them slip through the cracks. So this kind of money definitely helps with those folks. It helps with everybody. Before about our elderly, we get calls in this office just nonstop. Really very sad stories with elderly folks, people with families that are really struggling, and we want to make sure that we've got things in place to make sure that those people aren't living in their cars or potentially, having to move to other places that can take better care of them. We want to be able to take care of them right here in our community.
That's a great update, Jason. Thank you.
You're welcome.
Great news to hear.
Okay, now y'all have to remind me. I can't remember if we have a motion on this or not.
Okay, we do not have a motion yet.
Okay,
I think we're at the discussion point.
Okay, thank you, Frida.
Yes, ma'am.
So, does anyone have a motion on this item?
Yes, ma'am. Mayor, I move to approve the resolution authorizing the Amarillo Continuum of Care to apply for the additional 2020 funding from the CARES Emergency Solutions Grant Program up to the amount of $865,899 per the allocated designations to provide homeless prevention and rapid rehousing to persons experiencing homelessness.
Second.
Wonderful. We have a motion and a second. Any further discussion or questions from the council? Okay. All of those in favor of the motion, please raise your hand. I see 5. That'll pass with the 5-0 vote. Jason, thank you very much for the work that you're doing. We really appreciate it.
Thank you. Thank you all.
Item 3E is to consider the assignment of a contract to purchase real estate located at 812 Southwest 4th Avenue. Mr. City Manager.
Hi, Mayor. I'm really excited about this opportunity as it presents a great opportunity to wrap up the facility side of our bond propositions from 2016, but I don't want to steal Chief May's thunder. So Chief, take it away and walk us through the acquisition.
Sure. We just basically what we're looking at is acquiring this land at the address, and we want to eventually proceed with purchasing this piece of property to relocate our AFD fleet. And this is the group of our department that takes care of all of our fire trucks. We, again, from 2016, we'd had planned, this was part of the Prop 2 plans. We had money allocated to acquire some property right behind the admin building at 3rd and Van Buren. And due to some overages on some of the other jobs, the fire station rebuilds, it kind of ran us into a real tight window where we kind of thought this was off our radar to be able to accomplish. So thanks to one of our lieutenants, Ryan James, and to Deputy Chief Sam Bockham, they had situational awareness to notice this available property. And when we got to looking at it and had some off-site tour or off-duty tours of that location, we realized this would be perfect. So once we started to inquire about the price, and we decided for basically if we acquired this for a third of the cost for new construction, we could come up with a great solution. We can check all the boxes off of the Prop 2 goals for public safety for AFD, and I believe we match PD in there. We were able to check for all of our goals off for both agencies. And we acquire a piece of property that doubles or triples our workable shop area with higher ceilings. It allows us to fit 7 or to 8 fire trucks inside rather than having to drag everything out each night, drain the pump. So there's efficiency and effectiveness for our fleet maintenance, and that means less downtime on our fire trucks. And the growth opportunities as well for this location. We've got 7,000 square foot of office space that allows future growth into different phases to remodel for a classroom. This could eventually be our location for our quartermasters, and where we could just be more efficient as a department for orders for trucks and some of the equipment for clothing. There's just so many ways we can expand with this, and there's also a half-acre lot that we can fence in that could be used for pave. I mean, it just allows another area for growth. So, we appreciate all the city staff support and consideration for this, and again, the 2 firefighters, Chief Bockham and Lieutenant James, for even coming across this to make this possible.
Just from a history standpoint, I know we mentioned that we didn't have the resources inside to make this part of the project happen. Prop 2 included from the fire side, in addition to some equipment, the fire maintenance facility and new stations 3, 9, and 5. When we started doing the bidding on Station 3, it was clear that we weren't going to have adequate funds based on the square foot construction costs for those stations to be able to do all 3 stations and new construction on the fire maintenance facility, the fleet maintenance facility. So we very quickly accelerated Station 5 and Station 9, which were scheduled in years 4 and 5 of the bond program, up to, at that time we're in year 2, and just pushed them both forward immediately. We also postponed this project because we knew even pushing all projects to immediate, we weren't going to have enough funds to be able to do them all. So we were looking at either waiting for construction prices to come down, which is probably a long wait if forever, to possibly using the funds available to make enhancements to the current fleet maintenance facilities that fire is currently using. Both of those are not optimal. This site that was found by a couple of our firefighters is ideal. And Chief, I don't recall if you mentioned, it was built as a bus maintenance facility. So the doors, the slab, the weight characteristics of the building that it can handle, all of it is almost custom built, purpose built for what we're going to be maintaining, the size of equipment that we're going to be maintaining, and the flow through, the moving through the facility instead of pulling in and backing out or having something stick out of the facility. We can do all those things short of exercising ladders inside this building. So it is perfect for what we need to do. And like Chief Mays said, it's at a third of the price. So great work to the team. I just wanted to give you that history to show you, short of finding something like this, how far away from getting what we needed to get through these bond funds we were. And this is going to make it all possible. Under budget. I mean, we're not going to spend more than we had allocated through the 2016 for the fire facilities, on fire facilities. So this is going to enable us to get all the way there.
Great. Hopefully you can do it pretty quick, before 5.
Yeah, that is fantastic news, and that's absolutely how we like to see taxpayer dollars spent. And we love being able to support first responders and meet their needs too. But it's just like Lilia said in the last presentation or 2 presentations ago, there never are enough dollars to go around. So anytime you guys can find a value-based project that meets your needs so well, that's something for us to all be excited about. Okay, Council, any questions for City Manager or Chief Mays about the project? Okay, do we have a motion then on item 3E?
Yes, Mayor. I move to authorize the city manager to execute an assignment of a current contract for the purchase of a building and land located at 812 Southwest 4th Avenue for a new fire fleet maintenance facility in the amount of $600,000 plus closing costs and related expenses, which is fully funded by the 2016 voter-approved Proposition 2 bonds.
Second.
Okay, any discussion or questions about the motion?
Mayor, just again I know Frida just read it, Chief stated it, but this is fully funded by bond money that was already voter approved. This real estate purchase does not have any associated property tax increase, any spending from general fund. It is being used specifically for a project that was previously identified in Prop 2. So just wanted to say that again very, very clearly, because whenever people see on our agenda that we are purchasing property, purchasing real estate, that is a concern. And so just wanted to reiterate that one more time.
Good, thank you for that point. Any other points or questions? Okay, hearing none, I'll call for a vote on this item. All of those in favor of the motion, please raise your hand. Those opposed? Oh, it's 5-0, so we've got enough to pass that one. And that brings us to the end of our non-executive agenda. So, Mr. City Attorney, do you mind reading our dismissal language to executive session?
Not at all, Mayor. Pursuant to the Texas Open Meetings Act, closed session Amarillo City Council was announced on January 12th, 2021 at 4:06 p.m. under the following authority. Section 551.07 to discuss purchase, exchange, lease, sale, value, real property, public discussion such would not be in the best interest of the city's bargaining position. Section 551.087, discuss commercial or financial information received from an existing business or business prospect which the city is negotiating for the location or retention of a facility, or for incentives the city is willing to extend, or financial information submitted by the same. Thank you.
Thank you. We are adjourned to executive session.